plenty more networking opportunities networking session over a cup of coffee. But of that, the BIDA gave us this platform. Not only to talk to investors, but also to mingle with our industry, fellow colleagues and peers in the same industry. I think this is a wonderful opportunity, not only to help investors and find business opportunities, but also have a reunion. With all your professionals. Good afternoon, everyone. Welcome to the healthcare breakout session. Investment Summit. This session is organized by BIDA and Inspira Advisory and supported by Eastern Bank PLC. My name is Junaid Rabbani and I'll be your host for this session. We're extremely thrilled to have you here today. And we're looking forward to having a very exciting day, full of, or maybe a half a day, full of engaging discussions and meaningful networking. Just a bit of house rule, if you could have your cell phone kindly muted, we would be able to avoid distraction. If you have any question, or if you need any assistance, please raise your hand. The volunteers of Inspira Advisory and Consulting will find you and we'll try to solve the problem. Now, the purpose of today's session is to bring together investors, international businesses, and our key domestic players in the healthcare sector to explore new opportunities for investment, partnership, and growth. We are here to discuss how strategic investment
can shape up the future of the healthcare sector in Bangladesh, making it a win-win for all. Throughout the day, we have lined up quite a few exciting activities for all of you, starting off with a keynote speech, followed by a panel discussion where we'd have industry leaders talk about healthcare, pharmaceuticals, bioeconomy, and also the investment opportunities in Bangladesh. These sessions would be complemented by investment matchmaking sessions where there would be some pre-scheduled investment meetings in a designated room. If you haven't scheduled any meeting up until now, I think it would be, we will see if we can accommodate you within the time frame. If not, there will be more opportunities post this breakout session. So for that, you might have to register your interest with the Inspira Advisory and Consulting team members. And then, very interestingly, there's also a sector report launch that we're all looking forward to, followed by, again, a networking session, which probably started off informally long before this session started. Before I start this session, let me kind of hype up, or let me kind of throw you a couple of numbers so that you're all excited. I know you're all excited anyway, but since we've all had good lunch, I thought some numbers would really help us and to kind of like have the light bulb grow in us. As of 2025, Bangladesh's healthcare sector is estimated at $19.4 billion, with a 10.3% CAGR growth since 2010. Bangladesh spend $5 billion annually on medical treatment abroad, indicating a significant opportunity for local market retention worth of half the amount, if not the whole amount. With 112 million plus internet users in the country, Bangladesh is a prime market for telemedicine, AI-driven diagnostic, and e-health solution. In terms of medical equipment, 85% of devices are being imported with an expected market value of $820 million, estimated in 2025. Now, this is the researcher talking, but then I'm no health expert. So let's get all the experts up on the stage. But then before we kick off the session, let me invite the Honorable Secretary of the Health Services Division, Ministry of Health and Family Welfare, Mohammad Saidur Rahman, to deliver the opening address. Sir, if you could all. Thank you so much.
Respected guests, ladies and gentlemen, Assalamu alaikum. It is a great privilege and honor to stand here before you on this auspicious occasion of the investment summit, not only investment summit. I like to add an adjective here, very successful investment summit 2025. I extend a very warm welcome to all of you on behalf of the Ministry of Health and Family Welfare. I do strongly believe that your precious presence and valuable contribution today will facilitate the path of health sector progress to a newer height and new dimension. Through this convention, we are here to explore the immense opportunities that the healthcare sector in Bangladesh holds for both local and international investors. We all know that health issues are no longer the domain of the Health Ministry alone. Rather, it is a cross-cutting national priority connected to education, infrastructure, environment, and economy. We have experienced from the COVID-19 pandemic that the best health outcomes are possible when policy, people, and partnership are aligned, as well as coordination among all government agencies, NGOs, local actors, investors. The healthcare sector in Bangladesh is at a critical juncture, poised for remarkable growth. With a market value projected to reach USD 23 billion by 2030, it is clear that this sector offers tremendous potential for those who choose to invest. The healthcare market in Bangladesh has been expanding. Today, the challenge is different, but equally urgent. The July 2024 uprising reminded us of the deep interconnection between physical and mental health, societal healing and natural progress. More importantly, as Bangladesh approaches its graduation from least development country status, we must contribute to the drug discovery development ecosystem. We are now entering a new chapter in our health journey. Our tremendous scope for investment, innovation, and institution building. Allow me to highlight a few priority areas where partnership and can be game changing. Number one, non-communicable diseases. Diabetes, cardiovascular diseases, and cancer are posing increasing concern in our country. 70% of our total death accounted for NCDCs. And at least 5.5 million people are becoming poor due to higher 74% out-of-pocket expenditure. We invite investment in specialized care, cancer, hospitals, diagnostic innovations, and AI-powered early detection. Number two, digital transformation in the health sector and AI-driven services are well-known best practices in the health sector. There's growing scope for AI-powered diagnostics and robotic physiotherapy, especially in undeserved area. Third, there is increasing demand for medical equipment and devices such as diagnostic test kits, operation theaters, and ICUs, assistive devices, and can be considered for a window of investment. Fourth, our healthcare financing strategy 2012 and 2032 outlines the path of universal health coverage through strategic purchasing and blending financing. And finally, public-private partnerships represents a golden opportunity. The government is fully committed to enabling impactful, transparent public-private partnerships healthcare that requires your kind attention today. We all know health sector demands intensive cooperation, and cooperation requires coordination, leadership, and partnership. You have the leverage to persuade national and multinational responses to transform all words into action. Whether we established Center for Excellence, co-develop digital health solution, or scale up tertiary care, you are invited not just as investors, but as co-creator of a healthier Bangladesh. Before closing, I extend my deepest thanks to BIDA, Sajida Foundation, Inspira Advisory and Consulting, Eastern Bank Limited, and all concerned for bringing together such a diverse and committed group of stakeholders. আজকে যারা এই প্রোগ্রামে আসেননি তাদের ধারণাই হতে পারে না যে এরকম একটা নতুন কনসেপ্টে এত মানুষের আগমন হতে পারে। আসলে আমরা বিভিন্ন মিনিস্ট্রিতে কাজ করি, বিভিন্ন দপ্তরে কাজ করি, বাট দিন শেষে স্বাস্থ্যটাই মূল হিসেবে আমাদের বিবেচনায় নিতে হবে। আমরা হেলথ সেক্টরের অনেক সমালোচনা করি, আমাদের সার্ভিস নিয়ে কথাবার্তা হতে পারে, আমাদের অ্যারেঞ্জমেন্ট নিয়ে কথাবার্তা হতে পারে, বাট আমি কিন্তু বিকালে যাচ্ছি, আমি যাচ্ছি, আমার মাকে নিয়ে যাচ্ছি, আমার ভাই বোন সবাইকে, ছেলে মেয়েকে নিয়ে যাচ্ছি। কাজেই আমরা যদি ভালোভাবে বাঁচতে চাই, সুস্থভাবে বাঁচতে চাই, তাহলে আমার কর্মের এরিয়া যাই হোক স্বাস্থ্যে মনোযোগ দিতে হবে। আমাদের সেই সক্ষমতা নাই যে আমরা এককভাবে সব সার্ভিস দিতে পারবো। আমাদের সরকারি যে ব্যবস্থাপনা, আমরা 1% সেবা হয়তো দিতে পারবো, একটা গুরুত্বপূর্ণ পোর্শন পপুলেশনের কাছে আমরা যেতে পারবো, কিন্তু শতভাগ মানুষের কাছে, 17 কোটি মানুষের কাছে পৌঁছার সক্ষমতা আমাদের নাই। এজন্য সবাইকে সমন্বিতভাবে এগিয়ে আসতে হবে। এখানে অনেকেই প্রবাস থেকে এসেছেন, বাইরে থেকে এসেছেন, আগে তাদের একটা ফেয়ারে আমি কথা বলেছি, এই দেশটা আপনাদের, আপনার হয়তো কাজের কারণে, জীবিকার কারণে বাইরে অবস্থান করছেন, কিন্তু আমরা আপনাদের আত্মীয় স্বজন দেশে আছি। আপনার দায়িত্ব এই দেশের স্বাস্থ্য ব্যবস্থাকে ভালো করা। সেটা করার জন্য আজকে যারা এসেছেন তাদের সবার প্রতি স্বাস্থ্য মন্ত্রণালয়ের বিনীত আবেদন, আমাদের স্বাস্থ্য ব্যবস্থা সবার কল্যাণে, আপনাদের সবার সহযোগিতায়, এবং আমাদের যেটুকু দুর্বলতা আছে আমরা আসলে অনেক সময় অন করি না আপনাদের, সেই সমস্যা আছে। আমরা আপনাদের অনেক ভালো অ্যাপ্রোচ হয়তো মনোযোগ দিয়ে শুনিও না, সেই অভিযোগও আছে। সেই জায়গাটাতে আমাদের দায়িত্ব আমরা পালন করার চেষ্টা করব। কোথাও কোনো আমাদের ত্রুটি থাকলে, কোনো সমস্যা থাকলে দয়া করে আমাদের জানান, আমাদের দরজা আপনাদের জন্য উন্মুক্ত থাকবে। আমরা একসাথে কাজ করে স্বাস্থ্য ব্যবস্থার উন্নয়ন চাই, সবার সহযোগিতা চাই। সবাই ভালো থাকবেন। আসসালামু আলাইকুম।
Thank you, sir, for your very heartfelt, wonderful welcoming note. Like you said, sir, the government is doing a lot, and then the government is also acknowledging that some of the services could be criticized, and they're open to improving it. They're open to new suggestions from all of you. And the government also acknowledges that it is not possible to serve more than 170 million people in this country. They're doing a lot, but that is where, to cover the entire population, they want private sector engagement, and that's why we are here today. Thank you again, sir, for your heartfelt speech. Ladies and gentlemen, we'll now move on to our keynote speech, followed by a Q&A session. So after the keynote speech, I'll probably take 2 or 3 keynote questions for the keynote speaker. It is my distinct honor to introduce our keynote speaker today, Ms. Silvana Kadir Sinha. Ms. Sinha is the founder, CEO, and chair of Prava Health, a pioneering healthcare company in Bangladesh, which was established in 2017. Since its inception, Prava has served nearly 1 million patients and become a model for healthcare providers in other emerging markets and beyond. Ms. Sinha's leadership has garnered significant recognition, including being named a World Economic Forum Technology Pioneer in 2021. Her dedication to improving healthcare accessibility and quality has made a profound impact, and we are privileged to have her share her insights with all of us today. Please join me in welcoming Ms. Silvana Kadir Sinha.
Thank you so much. for the very generous introduction. It is truly a privilege for me to be here with all of you to talk about our nation's health and the great opportunities that exist for all of us to be part of Bangladesh's path to becoming the 25th largest economy in the next decade. Let me first introduce myself. I'm not the first entrepreneur in my family. In 1954, when Bangladesh was still East Pakistan, my paternal grandfather, Hamidur Rahman Sinha, founded a pharmaceutical company that is today the country's oldest and one of its largest and most successful. It's called Acme Laboratories, and it's currently traded on the Dhaka Stock Exchange. That's my grandfather there. At the time, in the 1950s, 80+% of drugs in the market were counterfeit, and many were very expensive imports. So my grandfather built a business that manufactured affordable medicines domestically, constantly warning all of us, if we ever cheat the consumer, it will be the end of us. Today, pharmaceuticals are the fastest growing sector in Bangladesh and one of the most dynamic industries across the region. Bangladesh meets 98% of its domestic demand and actually exports to more than 150 countries, including Europe and the United States. In 1964, my father earned a scholarship to go to the US to earn his PhD in pharmaceutical chemistry. The picture below was taken the day he left for the United States. He's the cute guy in the middle. He was 19 years old. He planned to return after studying chemistry. He planned to return home to help run the family business, but in 1971, after the War for Independence, he decided to stay in he decided to stay in the United States and become a professor. I was born and raised in the United States. I actually had a career as an American lawyer, working globally in international law and US foreign policy, before a decade ago, I moved to Bangladesh to build Brava Health. I moved here for the first time in my life because I saw this massive opportunity, both to generate a financial return and have a huge impact. My obsession with healthcare started in 2011 with my mother's appendicitis. I had traveled to Bangladesh from my home in New York City for my cousin's wedding. When my mom complained of a debilitating pain in her side, we rushed her to one of the country's top private hospitals. Unfortunately, the care she received was poor, and eventually, after her condition worsened, we traveled to Bangkok, where she had a second surgery, and a year later, she had a third surgery due to complications from the original procedure. This experience really opened my eyes to the opportunity that existed. I had seen all this tremendous progress in Bangladesh over the course of my lifetime. What it really opened my eyes to is what has now become my life's work. I don't believe that anyone should have to leave their country to access high-quality healthcare that they deserve. We heard this 5 billion figure. That's an estimate. I believe the number is actually probably even higher in terms of the dollars that leave the country to access quality healthcare abroad. We should be building that infrastructure here. I quickly realized, due to the gaps in the quality of care, that every day, thousands of Bangladeshis, and every year, billions of dollars, were leaving the country to access healthcare abroad. So let's set the stage with the current landscape. Our nation has made commendable strides in healthcare. Sorry. This chart shows how. You can see here, life expectancy in Bangladesh exceeds India and many of our regional peers, despite a relatively lower level of spending than many countries in the world. On social development indicators, Bangladesh is doing better than any other country in the region. This reflects the efficiency of our public system, which actually really prioritizes primary care. Even despite the existence of a relatively strong public system, even 37% of the masses who can't necessarily afford it are accessing healthcare for the first time in the private setting. 72% of health spending in Bangladesh comes from the private sector. This is even higher than India. The increase in the middle and affluent class is expected to reach 50 million by 2030. And this is really what's driving the growing demand for healthcare. As families have more disposable income, they inevitably invest disproportionately in the health and education of their families. It's what any one of us would do. Sorry, let me just. The health sector actually is growing, as you can see, even faster than the economy because of this. In the last 2 decades, we've seen the number of hospitals and diagnostic centers grow 6-fold. The health sector has grown at more than 10% compounded annual growth rate, as we've heard from some of the earlier speakers, since 2010. And health spending per capita is expected to double by 2040. The excess demand in the market is clear. The number of hospital beds per 1,000 inhabitants stands at around 1, and the number of, sorry, I don't know if you guys can see that slide, but the number of health workers, the WHO recommends that it should be, is around 3, and yet it's less than 2. So we really have tremendous opportunity. All of this underscores a significant gap between the infrastructure we have and the needs of our population. What this means is an opportunity for all of us here. To transform our healthcare system, I propose we must adopt a multifaceted approach. Number 1, increase healthcare investment, which we're here to talk about today. Bangladesh spends less on healthcare as a percentage of GDP than even India and China. Against the backdrop of growing demand for care, investors have a rare chance to tap into a growing wave of health spending. Let's be clear also. The number 1 reason that people are dying in Bangladesh and across most low and middle income countries is actually not just lack of access, it's lack of access to quality healthcare. This is well established in public health. What we need is investment in the basics, high quality clinics, labs, hospitals, training institutes across the board. The potential return on investing in this kind of infrastructure is enormous. We can even look around this room and see we even have healthcare billionaires here in Bangladesh and across Asia. Building systems at scale isn't just good for public health, it's a smart financial bet. Beyond infrastructure, investors should be looking at pharmaceuticals, drug development, API manufacturing, and biotech. And of course, digital health, which I'll talk about a little more later. The government also understands this opportunity. That's why it's welcoming investors with 100% foreign ownership and tax holidays for hospital projects. The door is open. Now is the time to step in and be part of building a healthier Bangladesh. Number 2, expand health insurance coverage. Only 1% of Bangladeshis actually have health insurance. So the number 1 reason a family falls back into poverty is a health incident. Implementing a common health insurance scheme will help to mitigate these financial risks associated with medical expenses. Health insurance plays a pivotal role in societal safety nets, bolstering healthcare of our citizens and access. This is another untapped area of investment given the low level of insurance penetration in our market. 3, develop our workforce. Another critical area for investment, which spans both health and education, is the training and education of healthcare professionals, doctors, nurses, midwives. It's not really just doctors. There's a lot of focus on medical schools. Our nursing and technician shortage is actually even more acute than the shortage we have in our country for doctors. Number 4, strengthen primary care. This is one that's very near and dear to my heart. Investing in strengthening primary care is the single best bet we can make to improve health outcomes in any country. It alleviates pressure on tertiary hospitals and the overall healthcare system. In fact, the public sector's emphasis on primary care is the major reason that we're performing so well on social development indicators. By investing in primary care as the initial point of entry into the healthcare system on the private side as well, we can ensure early detection and effective management of diseases, significantly reducing the need for advanced interventions and improving overall quality of life for our citizens. This is exactly what we're witnessing daily as the impact of primary care at Prava Health. Non-communicable diseases. We heard the Honorable Secretary mention this. Diabetes and hypertension are rapidly increasing, and they can really easily be managed in the primary care setting. This year, the government estimates 15% of our citizens suffer from diabetes. There's also a growing demand for integrated primary care services for our aging population. Within the next several years, 1 in every 10 Bangladeshis will be elderly. At Prava Health, we've observed firsthand that our patients who regularly access outpatient and primary care are significantly less likely to be hospitalized. Globally, what we're seeing is healthcare delivery is shifting from hospitals towards clinics and increasingly into homes. Which gets me to my final point, leveraging digital health. The digital health market in Bangladesh is growing rapidly at more than 10% CAGR. Technology is the future of healthcare and the present. We're already seeing it's reducing the timelines for clinical trials, improving operational efficiency for factories and providers alike, and reducing acute episodes for patients through remote monitoring systems, and helping them manage those, or helping them to know properly when they need to go to the hospital. It's also just simply increasing access through things like telemedicine and other remote monitoring. We have more than 112 million internet users in our country. This number will only grow. I'll leave you with one last comment and a call to action. The nexus between health and economic growth is undeniable. Bangladesh is projected to grow more than 5% this year. While this reflects the resilience of this extraordinary economy, we must acknowledge that health-related productivity losses could impede this growth trajectory. Investing in healthcare is not only a social imperative, it's an economic strategy. So I hope you will join us. A stronger, more prosperous Bangladesh must be anchored by a healthcare system that truly meets the needs of its citizens. This is a call to action. Let's empower every citizen to thrive. And in doing so, let's unlock the full potential of Bangladesh. Because behind every economic goal is a human story. We've talked about a lot of numbers today. But only when we build a foundation of health for all, every person, every mother, every worker, every person who has a dream for a better life can take part in shaping the future of dignity, opportunity, and shared prosperity. Thank you.
We'd like to thank the keynote speaker. Definitely, we echo the same sentiment that we shouldn't have to leave the country for accessing quality, affordable health care. I know many of you had questions, but since we're running behind time, so we'll have to skip the Q&A session, but then she's here. She will be here throughout the session, so if you want to catch her, I think during the coffee break or some other time, you can definitely access her or any other our other panel speakers. So we have designed 2 panel discussions for this session. We'd get on with the first panel discussion for this afternoon on unlocking healthcare investment potential. I'm pleased to introduce our moderator for the session, Mr. Sajid Ahmed, an investment banker turned development practitioner who's the regional director of Water.org, South Asia. Now, allow me to introduce our esteemed panelists and their organizations. As panelists, we have Mr. Martin Holtman, country manager for IFC Bangladesh, Bhutan, and Nepal. IFC, part of the World Bank Group, is a global leader in private sector development, known for its transformative role in financing and promoting sustainable investment. We have Mr. A.M. Shamim, founder and managing director, LabAid Group. LabAid Group is a leading healthcare provider in Bangladesh, renowned for its state-of-the-art medical facilities and high-quality healthcare services. We also have Mr. Futoshi Kono, Director, SHIP International Hospital. SHIP International Hospital is a standout example of foreign direct investment in Bangladesh's healthcare sector. Backed by Japan's SHIP Healthcare Group, It brings global expertise in advanced cardiac care and medical innovation to the local landscape. In addition, we have Dr. Hak Sun Kim, Professor, Yonsei University Health System. Yonsei University Health System, one of Korea's most prestigious medical institutions, is known for its cutting-edge research and high-quality healthcare services, advancing medical education and patient care in Asia. Last but not the least, we also have Mr. Syed Omar Kabir, General Manager, Renata Pharmaceuticals PLC. Renata Pharmaceuticals is one of Bangladesh's largest and most reputable pharmaceutical companies, recognized for its quality products and significant contribution to both local and international markets. May I request the moderator to accompany all our panel speakers to come on stage and to start the very exciting panel discussion that many of you are looking forward to. Thank you so much. Can we have a round of applause for our speakers, please?
I hope everyone has mics. We all have mics, right? Microphones?
Yes.
Great. Thank you. Let me start by saying what a pleasure and honor it is to be here today. This, of course, is an event that I was looking forward to greatly, the Bangladesh Investment Summit 2025. So just a bit about myself before we move on to the discussion. So this topic is close to my heart. I'm not a healthcare expert insofar as the quality of our panelists are concerned, but I have worked in financing for the longest time and investments, and something I've cared about ever since I moved back to Bangladesh in 2011 was getting more investments in the country. And I used to work with foreign investors, and one of the things I think people looked at when we spoke about investment opportunities in the country was, what are the safe sectors? What are sectors that will keep generating returns, that will give robust returns? And in all my time working with investments, one conclusion I've reached is that in a country like Bangladesh, which has obviously its share of historical risks, so to speak, you get these defensive sectors like healthcare, which also offer fantastic returns. So without further ado, I'd like to dive into this discussion and talk about the robustness of returns in this space, what the growth spaces are within the larger ecosystem of healthcare. As has been discussed already in the keynote speech that Silvana gave, this is a very exciting space. We have currently a market that's $14 billion strong and growing. There's a lot to do in this space. We don't have enough hospital beds. Clearly, the infrastructure has a massive space to grow. Income per capita for people of Bangladesh continues to grow. And as income grows, people obviously spend more on healthcare, spend more on pharmaceuticals, spend more on diagnostic centers, spend more on even advanced medical procedures. So this is, to my mind, one of the most exciting discussions we're going to have at the summit. And we have just the right panelists for the discussion. If I may start with Mr. A.M. Shamim. And Mr. Shamim is the founder and managing director of Lab 8 Group. So can we get a round of applause for Mr. Shamim? Shamim bhai, if I may call you that, I'd like to start off discussion by getting a perspective from you, because you have over several decades a unique vantage point of being able to see the healthcare ecosystem in its totality. If you could just set the stage for us and just take us through your experience as a leader in this space of where are we going with this sector? What does the future look like? What does the outlook look like? What should investors be looking at? Over to you.
Hello, শোনা যাচ্ছে? আচ্ছা, thank you all. First of all, I want to tell that our healthcare system and healthcare delivery is really good. And all of us should take services from Bangladesh. 2 weeks back, I was in UK, and I talked to 3 or 4 families. They're complaining a lot about national health system of UK. And you know that 2 months back, one CEO of an insurance company in US was shot dead by a patient relatives. So about Bangladesh, our healthcare system, you know, what we do a lot of criticism, it's not like that. Like for myself, I have done my angioplasty in Lab 8 Cardiac Hospital. My mother, she has done her like pacemaker in our hospital. And I know that 90% of the people who are here is taking their medical services from Bangladesh. So Bangladesh needs like trust, more development, more investment, but as a healthcare, we are not in that bad shape. So first of all, I want to tell that we are in a good track. Our, you know, pharmaceutical industry is very good, and it can defeat any country of the world. So I have confidence with our hospitals. We will not go to outside Bangladesh. We believe our doctors, we believe our healthcare, we believe our hospitals. So now I want to give some statistics, because I have been in this sector from 1985. That our healthcare, what we already told, that 20 to $22 billion, it has 5 or 6 like divisions. Primary healthcare, then pharmacy, pharmaceuticals, third like consultation and diagnostics, fourth is secondary healthcare, fifth is tertiary, and lastly digital health and telemedicine. And the breakdown is like that primary healthcare belongs to around 500 million businesses in Bangladesh. Consultation diagnostics is 5 billion, secondary is 2 billion. Tertiary, what we heard every day, that $5 billion patient is going to outside Bangladesh. That is actually tertiary care. There's another 5 billion, and digital health and telemedicine is less than $1 billion. So I want to now talk one by one all the parameters, like primary healthcare. Don't invest in primary healthcare because the return is very low, and what the money we get, from the banks is like high interest loan. BRAC has started this primary healthcare, but I have doubt that in primary healthcare, in private sector, it will not work. But on the other hand, government is working for primary healthcare, I know. The second is the like pharmaceuticals. Pharmaceuticals is doing very good, like 98% we are servicing from our side. Now the pharmacy chain, you know that in Bangladesh, food like Las Pharma, Apollo, then Tamanna, AKS, then Wellness, they are working for pharmacy chain. But don't invest in pharmacy chain because in the pharmacy, the margin is very low, 12.5%. We have already done 26 pharmacy. But you know the rent, this investment, salary, electricity, I can guarantee you that except Las Pharma, because their modality is different, no one can do profit in like retail pharmacy. Next is consultation and diagnostics. This market is around $4 to $5 billion. And you know, in last 30 years, Labade, Popular, and Ibn Sina are the major player. In last 30 years, no one could like sustain or stand in this diagnostic and consultation. Because here the doctors are the main players. If you like say at a small center, it's very difficult to get the patients directly. It is somehow referred by the doctors. So new investment in diagnostics, consultation, it will not work. Number 4 is the secondary. Like in Bangladesh, around 14,000 diagnostics and hospitals are working, like in remote villages, thanas, and they're giving 90% of the secondary services like appendectomy, cesarean section. You know, in a village of Rajshahi, they are doing a cesarean section only by 4,000 taka. So in secondary, like healthcare services don't invest. Now the main bulk came, the tertiary care. This is the area you have to invest. In tertiary care, what we every day see in the paper, patient is going, that is going, that. The real statistics is yearly 3.5 lakhs patient is going. Out of that, 2.5 lakhs is going for only diagnosis. The next part is cancer. We have started a cancer hospital. It has a good future. Second is transplantation. Because of our government policy, I am telling to our secretary also, because of our government policy, we can't do the transplantation. So every year, around 600 liver transplantation, 2,000 kidney transplantation, and around 2,000 bone marrow transplantation is going to India. So this 4,600 patient itself is near to $1 billion. So that this part we can think how to develop all the transplantation. Next, one by one, like cardiac, we have already given the services. Then nephrology, accident emergency, orthopedics, and neurology. These are the 6 or 7 hospitals. I will request the investors, just give the money in the 6 or 7 areas. Don't go for other places. You lose the money. In Bangladesh, like a good like Mao Shishu Hospital, you will not get. So do 3 or 4 Ma and Shishu Hospital. Last day I was meeting one lady, she was telling that my children, she is 7 years age, I don't find a doctor who can give 20 minutes time. So this is the area, just you think. Lastly, I want to tell that you will hear a lot of things about telemedicine, digital health. No, it will not sustain. For last 5 to 10 years, Pulse, Dr. Rola, I'm not telling them any bad thing, but because of the cost and the doctors are taking the maximum money. So this digital health, you will find the digital health, but it will not work. So these are the actual pictures. I am giving you the summary of the total healthcare. One thing more I want to tell, that is, say, now you speak after 5 minutes, please. Eh? So I'm not discouraging digital health, I'm not discouraging telemedicine. This is needed, but it needs
We'll come to you.
time.
We'll come to you. We'll come to you.
আচ্ছা, next
আপনি
the
বলার
thing
সুযোগ
is,
পাবেন। We'll come to you.
next the thing is what I'm doing, telling all these things from my personal experience. I'm not trying to make something narrow or small. আচ্ছা, like doctors from outside, like what we are doing now, going to China, this is not good for Bangladesh. Going to China is not the solution. Second thing is like the foreign management. You have seen that last 30 years, it's not working in Bangladesh. So my suggestion is, number one, invest in tertiary care. Number two, you select the long-term players in healthcare. Number three, invest in local hospitals, but make it strengthening by its quality with good governance. Thank you all. I don't want to make narrow anyone. Thank you all.
Thank you. So I think there was a question and a response from the audience. We will come to you, and I understand that there's diversity of viewpoints being discussed, which is exciting. So let's have that debate. We definitely want to have that, maybe in the Q&A section. So with that, I'd like to come to you, Omar. You've been patiently waiting. So very impressive CV, I have to say. And of course, you're with Renata, a very impressive organization with presence in over 50 countries, I take it. So I have a bunch of questions for you, but maybe let's start with the first, which has to do with, we were just discussing before this panel about the prospects of the domestic market. Maybe we start with that and your views on where it's headed, and perhaps also a bit about the importance of ROI, R&D, research and development in this space. Over to you.
Sure. So first, I'd like to thank everyone so much for having me on this panel. My name is Syed Omar Kabir. I'm a clinical pharmacologist trained at Oxford, and I basically oversee Renata's pharmaceutical division. Now, just echoing slight divergence from Dr. Shamim's words, I think, yes, a lot of the areas that he said to invest in are very lucrative, but there's 1-year ROI and there's also 6-year ROIs. And I think in technology and other services, while I'm not a health expert, I'm a pharmaceutical person, I'm sure people can see returns in the long term. I think that should calm a bit of our audience down. Now to what I'm actually here to talk about, which is the domestic pharmaceutical industry. So for the domestic pharmaceutical industry, I think the proof is really in the pudding. You know, Bangladesh has, other than the global powerhouses of pharmaceuticals in Asia, being India, China, and South Korea, Bangladesh is actually one of the strongest pharmaceutical industries in the eastern part of the world. And this has been fueled not just based on a population effect. I know everyone loves to talk about the fact that, oh, there's 180 million people, that's why the market is so big. Well, there's a lot of people in Indonesia. There's also a lot of people in the Philippines and in Pakistan. Why is Bangladesh's pharmaceutical industry performing so well? Well, you can boil this down into 3 factors. First factor is geographical density. So the fact that Bangladesh does not have a lot of land, that in most cases is a significant disadvantage. But in the case of pharmaceuticals, it is a significant advantage. Why is that a significant advantage? Is because we are able to access multiple pharmacies, multiple hospitals within a short geographical area. What that means is that you have companies, pharmacies, doctors alike in certain zones of the country. And that allows you to be able to control the entire commercial value chain. And I'm going to stress on this point a little bit more. Bangladesh is not dependent on wholesalers or large distributors. And this is what creates anti-competitive, oligopolist, monopolist systems like much of what we see in the US, where we have 3 main buyers for pharmaceuticals across the entire industry. In Bangladesh, you don't have that. In Bangladesh, you have companies that distribute their products direct to pharmacy, that promote their medicine direct to doctors, and this has allowed for the country to be able to have incredible access to medicine available throughout the country, even at last mile delivery. You know, we often hear about how do you get medicines to the most rural part of Bangladesh. Guys, go to the rural part of Bangladesh. There's 10 bloody pharmacies there. There's more pharmacies there than probably on my street where there's 2. So that's one, geographical density. The second thing is competitiveness. So while we, like to, traditionally, my father being a raging communist, would like to hate on capitalism, Bangladesh's success in pharmaceutical industry has really stemmed from extreme competition. I saw the likes of Mr. Halimuzzaman here. I see Simin Khala, Simin Madam here. I know all of us stay up till at least 1 a.m. at night waiting for our sales figures every night. And this competition has fueled innovation, it has fueled excellent operators, and what it's also done, which sometimes falls below the cracks, is the fact that it has created employment. And this is not low-skilled labor employment, but high-skilled, highly educated levels of employment amongst the youth. Before, if you were a biochemist in maybe 1996, 1995, thank God I wasn't studying biochemistry in 1996. I was being born in 1996, so that was a bit of a change. But if you were a biochemist or a biologist, you would go be a teacher. Now, that is a very, very noble profession. But sometimes people want to do other things. Today, if you're a biochemist, you could see yourself being a QA head, an R&D head of one of the largest companies, not just in Bangladesh, but in Asia. And this has happened due to competition. And the third point I would like to mention, before I just touch quickly on R&D, is operational efficiency. Bangladesh has, in terms of its pharmaceutical sector, incredible operational efficiency. In terms of market size, because the cost of our medicines are some of the cheapest in the world, it might not come up in dollar value. But if you look at, in terms of units, number of tablets, number of capsules, number of vials, Bangladesh is actually the 6th largest producer of medicine in the world today. And that has come from having incredible operational efficiency. We are lean, and we're able to produce at high volumes. And I'll give you some examples of that. During COVID-19, all of the Western world was running around chasing, where will remdesivir come? Where will molnupiravir? Well, a pharmaceutical company here called SKF was the first company to release remdesivir globally. And actually, there was countries around the world asking for remdesivir, being like, what do we do? The other thing, and this is something more recent, is last year, this country went through a political revolution, extreme volatility. Yet, despite having minimal, if not no price changes, the total market grew 12.32%. And during the August Revolution, and basically, a semi-civil war, all pharmaceutical companies were active. And we were producing products 24/7, 3 shifts, 2 shifts. Myself, I was waking up or going to bed really at 7 in the morning because I was making sure our distribution gets done before all the fighting starts at 10 a.m. That's how efficient this sector has become. Now, these are all very positive things. And traditionally, the domestic pharmaceutical industry has been immune to macroeconomic crisis. But this, unfortunately, is no longer the case, because Bangladesh has had a currency devaluation of north of 60%. Based on that, our cost of goods, whether that's our excipients, or raw materials, our consumables, all of these costs have gone up massively. So while companies have grown in terms of their revenue, their bottom lines have been significantly squeezed. As an operator, that's a terrible picture. But as an investor, that's a dream. Because today, pharmaceutical companies that used to trade at $1.6 billion in value with revenues of 500 million, that's roughly a 3x multiple on revenue, now they're trading at 1x revenue of their market cap. And this is not just public companies, this is public and private companies. So today, investors not only look at a sector that is poised to take on the global market, but a sector that as soon as pricing is accommodated to reflect the new costs, this sector will experience large gains in their bottom line because their revenues have grown, but their profits have not. As soon as this mismatch is mitigated, you will see gross profits and net margins go back to the 17 to 21% multiple that we used to see. Should I touch on the R&D part now? Or
we
maybe
can
after?
just come back.
Yeah, we'll come back
Awesome.
to that.
Thank you, Omar.
Thank you.
Appreciate the applause. Clearly what you had to say resonated with the audience. If I may turn to Mr. Futoshi Kono, who happens to be director at SHIP International Hospital. And this is interesting for those of you who are not aware of Mr. Kono's background. SHIP International Hospital is an international hospital in Uttara in Dhaka, and he is one of the investors. So he's actually done the entire journey. He's walked the walk of investing as a foreign investor in the country. So I'm optimistic you'll have tidbits to share, insights to share that'll be relevant to other foreign investors. So why don't you, if I may ask you to just take us through your journey of what are the challenges and opportunities you saw along the way, and what's been your journey like so far in setting up this hospital? Over to you. I think the mic needs to be switched on. If someone can come. Thank you.
Thank you very much. I'm Futoshi Kono, and I would like to explain the point of view of foreign investor from Japan. SHIP Healthcare is a Japanese major healthcare business group and has been involved providing hospital facility, logistic, and elderly care service. In Japan, where the birth rate is declining and the population is aging, the healthcare industry is shifting to care mix and elderly care, AI diagnosis, and genetic therapy. But we believe that our SHIP strength in hospital development technology will have a lot of space to play in the global South market. As we know, Bangladesh has very large demographic bonus with young population making up to 2/3 of total population. And the population is expected to grow for a long time until 2070. In addition, top 4 major deaths in past 20 years has been replaced by lifestyle disease such as stroke and heart disease. So we believe that this is the country that will need acute medical care centered on surgery and other such treatment from now on. Therefore, our group established the joint venture in Bangladesh from 2016 and completed the renovation work within 3 years. From 2020, we served for COVID-dedicated hospital 2 years. So that's why we started general service from 2020 and started cardiovascular service from 2023. So due to 2 years pandemic period, we are now in the 4th year of general operation. So we just one step away from break even. However, there is a very strong demand of advanced medical care for heart disease. And we had a good start with 150 cardiac surgery cases from the beginning year. Our hospital has strong cardiovascular surgery team, including 2 Japanese experienced senior surgeons and 4 local surgeons. The history of cardiovascular treatment in this country started with technical transfer by JICA, Japan. And number of bypass surgery performed annually is very much competitive, even to Japan. However, since aortic aneurysm treatment is more than 20% of total cases in other Asian countries, like India, Japan, Korea, only very few cases performed in this Bangladesh. Due to this circumstance, we believe more than 30,000 patients are dying without treatment. But hopefully, we already have provided this service in this market. So we are turning our attention to this field, currently working to technical transfer and development in, with the support with Japanese Ministry Economy, METI, and Bangladesh NICBD in Global South project from this year. Thank you.
Thank you. Thank you so much for your very succinct and very positive storytelling. I'm sure other investors will get to speak to you after this if they want to know more. So with that, if I may invite Dr. Hak-Soon Kim. By way of a brief background, Dr. Hak-Soon Kim is a professor at Yonsei University Health System, and he wears many hats. In addition to being a professor and a spine surgeon, he's also an expert in hospital infrastructure planning and management, which is something I think we need in Bangladesh. And he's had this experience in China, Korea, and of course now Bangladesh. And Dr. Kim actually has a translator. So I will ask the question, which has to do with, I would like to understand from the perspective of hospital infrastructure planning and management, and all the experience Dr. Kim has had in other countries, especially in China and Korea, what are some lessons for Bangladesh?
예, 안녕하세요. 저는 한국에서 온 김학선 교수입니다.
Good afternoon. I am Dr. Hak-Soon Kim from Korea.
예, 저는 병원을 건립한 경험이 한국, 중국, 그리고 치타공에서 지금 막 시작한 세 나라에서 병원 건립한 경험이 있습니다.
I have experience of planning and managing hospitals in Korea, China, and Bangladesh, Chittagong.
병원 인프라를 계획하고 관리할 때 가장 먼저 해당 지역에 대한 인구, 건강 문제, 기존 인프라에 대한 충분한 이해가 필수적입니다. 예를 들어서 저희가 세브란스가 합작한 칭다오 세브란스는 그쪽에 고령화에서 뇌, 척수, 불구들이 많아서 이런 경우에 재활 중심으로 가고 있습니다.
So first, when it comes to planning and managing healthcare infrastructure, it is essential to have a profound understanding of the region's demographics, health issues, and existing infrastructure. For example, Severance Hospital is currently working on a joint venture in Qingdao, China. Given the aging population in Qingdao, there is a relatively high number of patients with chronic conditions related to brain and spinal disorders. Considering these factors, we are building a hospital specializing in rehabilitation.
두 번째, 관계자들 사이의 협력이 아주 중요합니다. 그 나라의 중앙정부, 지방정부, 의료기관이 협력해서 일관성 있는 정책을 가지고 꾸준히 유지해야 됩니다. 제가 과거에 한국에서 병원을 만들 때는 그 지방정부가 행정적으로 그리고 경제적으로 많은 도움을 줘서 토지를 제공하고 일부 건설비까지 제공했습니다. 그래서 저희가 시작한 지 5년 만에 개원을 해서 환자를 보고 지금 2년째 잘 보고 있습니다. 이에 비해서 제가 칭다오에서 한 것은 중앙정부하고 지방정부하고 환경 문제로 좀 트러블이 있어가지고 늦어져서 같이 시작했는데 지금 이제 이 안에 공사를 하고 있습니다. 이런 식으로 중요한데 이에 비해서 치타공에서는 영업무역과 같이 해가지고 굿 파트너가 있어서 지금 2년 만인데 파일럿 병원을 벌써 건립해서 개원하고 있습니다. 나중에 잘 돼서 400베드가 되기를 기원하고 있습니다.
And secondly, close collaboration among stakeholders is crucial. Central authorities, local governments, and healthcare institutions work together to implement coherent policy. I worked to build an expansion hospital in Seoul, and it was with the Korean government's help. Thanks to the administrative support and land provision from the local government, we opened the hospital just 5 years after planning, and after 2 years, we're still running it smoothly. In contrast, the hospital project in Qingdao started around the same time as the project that we did in Korea. However, it is still in the construction phase due to the different understandings of the environment. And however, in Chittagong or Chatogram, thanks to our trusted partner Youngwon, we have opened a 100-bed pilot hospital in less than 2 years since the project began, and we are planning to open a 400-sized hospital as well.
현재 방글라데시의 의료 시스템을 강화하기 위해서는 일부 동의를 안 하신 분도 있지만 전체 의료의 EMR이 필수적입니다. 이런 EMR을 필수적으로 해가지고 그 결과를 가지고 평가해서 나중에 원격 질서도 할 수 있는 기본 자료가 되기 때문에 필수적입니다.
In order to enhance the medical system, I believe that this may be a topic that people might have different opinion on, but I believe that EMR is very important and it's so crucial. With standardized EMR throughout the country, the efficiency of the treatment will go up, and it is the basic and the ground backbone data, so it is really important.
두 번째는 의료 전문가 교육을 체계화하고 객관화해서 해야 됩니다. 그래서 고품격의 의료 전문가를 만들어야만이 우리 같은 투자자가 병원을 오랫동안 안정적으로 유지할 수 있는 근거가 됩니다.
And secondly, organized medical professionals training is paramount. High quality medical education is essential for investors like us to operate hospitals sustainably, effectively in a long term.
이것이 저희가 메디컬 스쿨도 만들려고 직타공에서 만들려고 하는 근본적인 이유가 됩니다.
This is the very reason why we're trying to build a medical college in Chittagong as well.
예, 감사합니다.
Thank you.
That's very exciting, and we're very thankful that you're lending this expertise to Bangladesh, and I do hope you're able to leverage from your expertise in the coming months and years. With that, I'd like to move to Martin Holtman, the country manager of ISC. Martin, I've had previous trysts with the ISC, especially when I was at a brokerage company in Bangladesh overseeing foreign investments, and previously when I was at Morgan Stanley, I recall us marveling at the returns IFC generates globally. So IFC is, of course, a very astute investor. And in your case, of course, because you've had this wonderful portfolio of experiences in East Africa, Latin America, and Russia, what I think I would love to know from you, and hopefully the audience as well, is your take on Bangladesh as a market, as an investment destination, given the fact that you've had these experiences in other markets as well, especially for healthcare, of course.
All right, well, thank you. And thank you for, in my language we say, thank you for the flowers. For the praise. First of all, there is no perfect healthcare. I think this was said before, right? You go to any country in the world and you ask them about how they like their healthcare system, and people are going to mostly complain. It's like farmers, when you ask a farmer about the harvest, you'll never hear it was just perfect, right? It's just part of human nature that we're not satisfied with what we have. I just spent a week with a British colleague, and you can ask the British about their national health system and what they think of it. When we take that as a baseline, I think, and Silvana said that very clearly in her opening speech, in her keynote speech, Bangladesh has done extremely well compared from where we came from. We've progressed to a level that many other countries around the world actually aspire to in terms of longevity and the availability of primary health care especially. Now, we have made investments in IFC and the healthcare sector here. In fact, I sit here with two clients, flanked by two clients. But I also have to be very modest here. Out of probably more than 120 investments and $9 billion that we have invested over the years here in the country, we have done 3 investments with less than $100 million in the healthcare sector. Okay, so for us too, this is a nascent space. My own journey in the health system here has actually been good. I've had to go to hospital a couple of times, and I really have to say I had nothing to complain about. Now, maybe I lucked out. Maybe I went to, because it was United and Prava, I went to some of the, the better performers. But my own customer journey, and for those of you who are from outside of Bangladesh, I just invite you to, use the services yourself to see just how good they are. Now, what about the market? Now I come to your real question. So what's the assessment of the market? The market potential is huge. We've all already heard the numbers. Silvana shared some of them. The gross numbers, the macro numbers are amazing. The market should be at least 4 times bigger than what it seems to be right now. So we're talking about a health market that should be in the range of $40 to $50 billion a year, rather than where we are today. As a minimum. We have huge room for growth, especially with the growing middle class. We have the lowest bed density, the lowest physician density, and the lowest nurse density in the region. India has 3 times the number of nurses per 1,000 population, and Nepal 5 times as many, okay? And we just heard here from the real investors, because these are the people who are really putting their own money at risk, just how important it is to invest in those kinds of services. What are the big growth areas for the private sector? I think this has been mentioned many times, mostly in the NCD space, because that's where middle class spends money. That's where the market potential is. And it's kind of both a curse and a blessing that those needs are rising in this market, and that's cardiovascular, neoplasm, which is cancer, and metabolic disease. We are facing an avalanche of metabolic disease in this country. It's horrible. It's really horrific. Not only in Gulshan, it's also in the village, because as a country, as a nation, we eat way too much sugar. We're sugar addicted. Okay, so I will add one more for the private sector that hasn't shown up yet, which is dental. You can make tons of money as a private sector investor in dental services. And as societies become rich, they want to have nicer teeth. And it is actually a matter of health. I'm not a health expert, unlike some of the other people on the panel, but tooth care is, of course, dental care is something that's extremely important. I'm totally enthusiastic about the pharmaceutical sector. I think you made a super pitch as to why we are so competitive in that. I think many of the same advantages that apply to the garment sector also apply to the pharmaceutical sector here, in terms of just our ability to be world-class competitors. What would it take? So why don't we see a stampede of investors coming in from outside? It's maybe the last question I want to ask myself here. Why aren't we seeing more of them? Okay? Why don't we have British, American, French, German, whatever investors or Indian companies coming in? And the Indians are here, but mostly in diagnostics so far. Well, because the market is completely closed. It's completely shut off, okay? And so we need strong reforms in terms of easing market entry, making that just easier to get in, also making it easier, and this is part, of course, a big of the topic here of the investment summit, how to bring money in but also take money out, because that's the deal. We will not attract investors if they find it too hard to also take their profits and their dividends out of the country. Fortunately, the current government is doing a lot to help to change that. We have, of course, a lot of red tape. We need single window licensing, tax simplification, and of course, as had been pointed out by my co-panelists, a lot of complementary services in training staff, because health services at the end are depend on people, on trained people. And the good news is we have millions of them. We need 2 million jobs every year just to accommodate the entrance into the labor force. And health services, to me, sounds like one of the best things we can offer them. Thank you.
Thank you, Martin. That was extremely comprehensive and a whole set of insights. And I just wanted to echo your perspective from my personal vantage point about the need for reforms and that the time is right. And big kudos to the government, the interim government, for taking this seriously and taking this up. So we're doing well in terms of time, but we don't have time for a full second round of questions. So I just want to open it up to panelists who might want to add. I know you do, and you have a perspective that we were discussing that I think is very valuable for the audience regarding R&D. So maybe we start with you, and if anyone else wants to chip in and add further thoughts for the sake of the audience, feel free to. Omar, over to you.
Sure, thank you. So I think one of the things that I wanted to mention is, you see that 98% of local demand is met through the pharmaceutical industry as a whole. However, Bangladesh, has not done incredibly well in terms of pharmaceutical exports. And that's why we advertise the number of countries we're in, as opposed to the dollar value of our export industry. And that's largely because Bangladesh has been, in my view, and perhaps some people as well in the industry, believed sort of in the thesis of our facilities are beautiful, business will come to us. Unfortunately, this is not true. No one will try and save $1,000 per batch of, let's say, 50,000 tablets just to move their manufacturing over to Bangladesh. You need to offer more than just cheap costs. You need to offer value in terms of IP, you need to offer value in terms of your R&D, and mostly in terms of your differentiation. And what does that really mean? Well, basically, to be able to be good in pharmaceutical exports, you need to be able to develop products that are bioequivalent. Bioequivalent basically means your drug and the innovator drug are performing the same in a human body, and that you measure that through clinical trials, which you will hear from a panelist on the next panel as she's taking strides to open up a CRO in Bangladesh. But the main thing here is Bangladesh right now has very few overall drugs approved in regulated markets. Renata last year managed to launch 13 new drugs across the EU, Australia, US, and now we've received approvals in Canada, and we have over 78 bioequivalent drugs. But this has taken more than 7 years and a considerable amount of R&D investment. Now, I truly believe with the type of investors that are in this room, if you are looking to invest in Bangladesh for both the local and global market, you need to think about investing in companies that truly display a strong prowess in R&D. And we need to move away from thinking just high volume to high value, high complexity. Because the future of pharmaceutical exports is centered around drug delivery. Can you make drugs that, instead of taking an injection once a day, it's once a year? Can you make a injectable that used to be, in an infusion bag in hospital, driving up healthcare economy costs, to something that's in a pre-filled syringe that you can take at home? This is what you call value-added medicine. And these products actually have considerable amount of IP. And you are able to retain your basically brand or license for years on end, and offers great life cycle management. The other thing with R&D that's very, very important in Bangladesh is we think Bangladesh's cost advantage comes from unit cost per tablet or capsule. We are incorrect. That is absolutely not the case. If you compare our conversion costs relative to our most successful neighbor in pharmaceuticals, India, we're basically 5% cheaper. No one cares about 5%. Really, no one cares about 5%. Pardon me. What people do care about, though, is arbitrage. As an investor, you're looking for arbitrage. Where are you finding the most value? Well, in Bangladesh, your R&D costs are 50% lower than other generic markets for complex drugs. Your analytical costs are 38% lower. What this means is, if we have an industry where investors are continually putting in money into R&D, we will be able to develop products faster, cheaper, and own the IP. So the CMO business, in my opinion, is not a good business. CDMO, or developing your own products where you do contract development for somewhere else, or you do your own R&D, that is a good business. But that business requires investors. Really, it requires dollars, because we are purchasing expensive raw materials and things like that for development. We don't have any returns on this. This is purely on a risk basis. But if investors truly want to see astronomical returns, this is an area where Bangladesh needs money coming in globally. And I really strongly echo the statements that Martin made, is that investors need to see a way to get exits. Well, in R&D-based products that can be exported, you can be very creative. You can co-own the asset. You can co-own the license. It's not like you have to say, hey, I'm going to own half your facility. You don't have to own the facility. You have to own the IP. And for that basis, it's much easier to get money out of Bangladesh and get dividends elsewhere. So I think that's really why I'm a strong believer in R&D in this sector. just because I'm sub 30, I have to say this before all my colleagues will, hate on me. The R&D vision or the momentum behind R&D as well is actually being carried out by young people, by the youth of Bangladesh. And that's also why you see scientists, I'll give you an example. We invented a drug for pediatric leukemia. Other than one guy who was 48, the rest of us were 24 when we came up with the idea. And this drug is a patented drug. Bangladesh has young people, young smart people, and this is where I think the opportunity for pharmaceutical exports really stems from. Thank you so much.
Thank you so much, Omar. That's a great note to end this on. We're actually running out of time. I'd love to engage you after this panel, and I hope you get to interact with our panelists. Can we get another round of applause for all our panelists? Thank you, everyone. Thank you.
May I request all of you to kindly just be seated. I think we would like to have the launching of the healthcare sector investment report, and for that, may I also call upon the Honorable Secretary of the Health Services Division, Ministry of Health and Family Welfare, Mohammad Saidur Rahman Sir, Mr. Mohammad Salman Rahman, Director and Partner of Inspira Advisory and Consulting Limited, and representatives from the partners of this event, Mr. Ahmed Shaheen, Additional Managing Director, Eastern Bank Limited, and Ms. Zahida Fiza Kabir, Chief Executive Officer, Sajida Foundation. This report was prepared by the session co-organizer, Inspira Advisory and Consulting Limited. Inspira is a management consulting firm offering market research, project feasibility study, and investment facilitation services for domestic and foreign private sector entities. There will be plenty of copies of this report. You should be able to avail this on your chair, or if you can also ask Inspira volunteers, or you can also scan the QR code, go to the Inspira website, and subscribe to their regular newsletters and monthly updates. If you could all come a little forward, and then our other guests, please, if you could kindly join them. We're constrained by the space, but then I think we could all accommodate all of you, please. You'd be happy to know that the report provides strategic insights around investment opportunities across the key healthcare industry verticals in Bangladesh. Can we have a round of applause, please? As I was saying, at the end of the report, there is a section featuring the detailed market entry and regulatory approval steps for any foreign investor targeting healthcare, pharma, or medical equipment subsectors. You can visit Inspira Advisory and Consulting Limited's website by scanning the QR code at the end of the report and subscribe to their periodic updates and industry insights. May I request all of our panelists to please stay with us, because we have another panel discussion now, and after that we're going to have the networking session over a cup of tea, which will be served right outside. We now move on to another important discussion where we talk about Bangladesh being the regional biohub. How can the country's emerging bioeconomy deliver better healthcare and attract investment? I'm pleased to introduce our moderator for the session, Dr. Syed Muntasir Mamun, Chief Innovation Officer and Director General, Ministry of Foreign Affairs, Bangladesh. There's a bit of commotion in the room that is normal and expected, but may I also request all of you to please kindly take your seats. There's another panel discussion. This is the last panel discussion for this healthcare breakout session. After that, we're going to have investor-investee meeting. Sorry, after that, there'll be coffee break, followed by investor-investee meeting and a spotlight session where some of the industry veterans will take the stage for 3 minutes each and would talk about the investment opportunities in Bangladesh. So don't miss out. I know there's one panel discussion we just had wrapped up one, but then there are plenty of industry stalwarts in this room, and we'd like to hear from all of them. Now let me introduce our esteemed panelists and their organizations. As panelists, we have Dr. Abed Chaudhary, co-founder and chief scientist, Genofax Life Sciences. Genofax is a life sciences company using genetics, microbiome science, and AI to deliver innovative healthcare solutions. Ladies and gentlemen, we are starting the second panel discussion. I would highly appreciate your cooperation. We also have Mr. Fabrice Gachot, Senior Business Development Leader, Cytiva. Cytiva is a global life science company providing technologies and services for advancing biopharmaceutical research and manufacturing. Ms. Sadaf Saz, founder and CEO, Eskejen. Eskejen is a pioneering clinical research organization in Bangladesh, advancing biotech and clinical trials. Mr. Yuji Wagata, Chief Representative, Toyota Susho Bangladesh. Toyota Susho Corporation invested in Mayap Inc., a healthcare startup operating in Bangladesh, developing telemedicine. As I call your name, may I request all the panelists and speakers to be ready here, and all of our esteemed guests, if you could kindly be seated. I'm sure there'll be plenty of networking opportunities. And also we'd have Mr. Sajid Rahman, Managing Partner, MyAsia VC. MyAsia VC is a prominent venture capital firm focused on investing in innovative startups globally, with a key focus on healthcare and biotech companies transforming healthcare landscapes. Wonderful. We have all the panelists up on the stage. Can I have the moderator as well? Dr. Syed Muntasir Mamun. Wonderful. I leave the responsibility to you to attract the audience back again and to also kick off the discussion. Yes, you have a microphone. Carry on, please. Thank you.
I believe I'm audible. Can I have your attention back? Well, I do have your attention, for sure. Can I have you back to your seats, please? Hi, this is Muntasir. I happen to work for an organization called the Minister of Foreign Affairs. But more than that, probably I should have been belonging to someone of this, an esteemed group of panelists, scientists, researchers, entrepreneurs, and even a poet and a literary activist. So here we are today. We are going to speak about trade, investment, technology, one of the most cutting edge of technologies that has ever been. Basically the next frontier, because some of you might be knowing that I work with artificial intelligence. The immediate next frontier of that artificial intelligence is bioinformatics and the biologic, not the biologics per se, but the whole spectrum of it. But more than that, I believe we are not here for that only. We're here for a dream. For some, let's say, when most of the people here in this room have grown up with the likes of Bionic Woman, $6 million man. Now, if you take that fiction out of it, that science has become reality. When and how it would become a commercial product, that's of course a question, but it's there. So here we're speaking about life, death, and probably beyond. I have been asked to economize on time because I have been known to speak a lot, and everyone here is almost the same. So we have been asked to economize on time so that we can meet face to face and everyone can speak. Today, this session, particularly this segment of the panel discussion, of course, there will be questions, there will be answers, but we expect you to engage in the melody of dreams, a full medley of dreams. What is it? If you look at the panel discussion, Bangladesh as the regional bio-hub, what is it? Why are we here? We have spoken, we have heard from the healthcare segment, and I believe that we have been sufficiently energized. Bioinformatics, bioeconomy, the whole range of bioeconomy elements, verticals, stand on top of this healthcare segment. But it actually affects everything that is known to us. It's not only a new branch of science or technology for that matter, or for that matter, life and living and livelihood. It's much more than that. It's probably a whole universe unfolding before us. As we move forward with our computational capabilities, the next round of evolution would start from where we achieve tech singularity. What happens then? How do we access the information which is encoded in our DNAs for millions and probably billions of years? And what happens when we know about it and what do we do with it? It's not only CRISPR or Cas9, it's much more than that. Every one of us, both from the science and technology background and also from the investment, or even for that matter, spectators' divine will, we belong here. So now that we have everyone back to their seats, I believe that I can sufficiently have the audacity to request Dr. Abed, one of the most prominent geneticists that this land has produced, and you might be knowing him for his groundbreaking research in rice production, climate-resilient rice production, and also carbon sequestration in the process, and also personalized healthcare. And I would like him to introduce the subject properly. Dr. Abed.
Thank you. Can you hear me? It's all good? Yeah. So I'd like to introduce you this term bioeconomy, which is a very grand term, which kind of suggests that any living organism that can be used to do something commercial is implied. And this kind of grand name doesn't really bring the focus of where an investor could invest and what would be a meaningful concept. So I think following the trend of the previous set of discussion, which I was sitting and listening with rapt attention, I want to bring some focus and describe a kind of an investor-friendly version of bioeconomy. So roughly, anything that is living is biology, and if you use a living organism to do something commercial, it would be bioeconomy. But I don't want to go into this grand definition. I would rather focus on some, what we would call molecular biology, kind of modern biology economy, as opposed to just bioeconomy. So you can imagine that bioeconomy is a grand term. The geoeconomy would be petroleum because it's geology. Bioeconomy would be just, even rice production could be bioeconomy. But we are not discussing agriculture here. However, we are talking about the modern version of agriculture. So if you sequence the rice genome and find that there is a gene there that promotes allergy, then suddenly you are talking about bioeconomy. If you, similarly for any living organism. So the whole financial footprint of bioeconomy, if you look up the literature, and depending on who you are talking to, is thought to be about 1.5 trillion globally, and is going to become like 5 trillion in 5 to 10 years or something like that. You get this kind of number bandied around. And that constitutes, what does it have? We were talking about the health services before, so the medical aspect of it is very important. But have you noticed that when we talk about health, we are actually talking about disease? We are talking about the absence of health. Most of the health discussion is centered around disease. And so we have a problem in our narrative, actually, because we should be talking about the maintenance of health, not the failure of health. So the maintenance of health, that information is in our DNA. So imagine if I had my DNA sequenced, and if I was only 1 month old, then it could predict whether I'm going to later have metabolic disease or heart disease or all the non-communicable disease, that signature, the genetic and epigenetic signature, is there in our genome. So I would ask the investors to come and invest in genome sequencing in this country. But what you find that if you want to sequence your genome, the DNA, the reagents cost too much, so that is not allowed to come in, and this is why that cannot happen. So this is a big problem. So I want to define in terms of what the moderator was talking about. So there is a genomics, which is the sequencing of all living organisms. Recently, India sequenced 1,000 genome to show the diversity of Indian population. Our population is very diverse. So this is not just the DNA sequence, but how the DNA is packaged, and that field is called epigenetics. So this is genomics, epigenomics, and then there is a transcriptomics, how the gene is expressed, and finally how the DNA sequence become part of digital analysis, and that is bioinformatics. So when we say digital health, we don't mean telemedicine. We don't mean like some kind of app where people will click and doctor will emerge. When we say digital health, we mean the DNA sequencing-based assessment, the predictive assessment of disease before it happens. So I think in summary, if I were to define bioeconomy in a modern way, I would say it's DNA-based, just to have a focus in it. It has transcriptomics, which is one way of saying how the genes are expressed, or metabolomics, which is the ensemble of all the metabolic small molecules that we have in our disease, and pharmacology is part of it. And then how to do about it is what we want to do, get investment in this country, and this country is eminently capable of handling that kind of investment. So that's how I would define the bioeconomy in the context of Bangladesh.
Thank you very much, sir. I believe that this is a very important area, because in last maybe 400 years of human history, this is for the first time that we are at a cusp when almost everything is possible. You just have to have the intent, and then the materials, the minerals, the processes will appear. What we call it, it's the SPOC model: systems, processes, organizations, and cultures. What you need to have is a culture of innovation and probably understanding, awareness of what we are dealing with. Next 3 years would be interesting to be the list. We'll come back to that, and we'll come back to Professor again. But before that, since he spoke about molecular biology, we'd go to one of the molecular biologists ourselves, and a poet and a literary activist, Sadaf Saz. My specific question to her would be, Ms. Sadaf, your company, Escogen, is one of the few CROs in Bangladesh. Out of 20 registered ones, probably one of the few very active ones. Now, CROs, what it is, she will tell. But some of our neighboring countries has thousands of them, whereas we have 20. Why do you aim to be in this sector? And how do you see CROs and the emerging biologics sector working together to boost Bangladesh's position in the global healthcare industry?
Well, thank you very much for having me. And it's great having the opportunity to talk on something that I'm completely passionate about and I'm extremely excited about. I started Escogen, which is a contract research organization. So what is a contract research organization? It provides outsourced research services to the healthcare, biotech, and pharmaceutical sectors. Usually what it does is tries to give cost-effective, efficient, scalable support to drug development and bringing therapeutics to the market. How does it does this? Historically, it has several ways in which it does give research support. So there's the preclinical phase, which is giving lab support and using drugs in animal models, giving that kind of support. There's something which I'm sure everybody's heard about after our COVID phase, which is it supports clinical trials, phase 1, 2, 3, 4 clinical trials. It also gives very important regulatory affairs support, data analysis and biostatistical analysis, as well as medical reporting and safety monitoring. But I think we're at a very kind of interesting juncture here. The previous session talked about the thriving and growing pharmaceutical sector where we're exporting to over 150 countries. and Saeed Umar Kabir had talked about the need for bioequivalence. Studies where whatever you're exporting as a generic or as a biosimilar is very similar to the original innovator drug. So you need bioequivalent studies. So right now in the Bangladesh market, there's about 100 million, but I think that it's actually much more gap of a lack of local CRO capacity to be able to do bioequivalent studies. And that's one of the things that my company, I think, is going to be very successful at doing. We are doing it here and now in Bangladesh, and we need that kind of support to be able to do much more. So when you're looking at a sector like the pharmaceutical sector, one of the things is how to bring new drugs to the market. So Bangladesh has like 180 million people with a very diverse genetic pool and also therapeutically quite naive. So this population is savvy, it's open to new medical interventions and treatments, and it's actually an excellent place for having first in-country clinical trials. At the same time, we are unfortunately having a greater increase of non-communicable diseases. As I said, the mortality rate per annum is 74% now. And we have a large patient pool. So with our, we were talking about our skilled workforce. We have like 10,000 medical graduates coming up per annum, 15,000 life science graduates. We can actually leverage our demographic dividend not only in the manufacturing sectors, but also in knowledge-based sectors. We have 100+ medical colleges, 600+ hospitals that are absolutely ready to have great partnerships to do research. So clinical or contract research organizations can actually help bridge the gap and work with manufacturers, work with global partners to do bioequivalence in Bangladesh, to actually make Bangladesh a hub for first in-country clinical trials as well as phase 2 and phase 3 clinical trials. One of our competitors is India. India has rising costs, compliance issues, regulatory issues, regulatory delays, and also I think Bangladesh has a special factor, which really proves that we have the grit, the resilience. We are a country which is based in ethical and knowledge-based innovations. We are an innovative country, and we have that resilience. So I think what Umar was saying in the previous session was we can really help accelerate innovation, as in organizations like us can work with companies to accelerate innovation, to ensure high quality and ethical and regulatory adherence, to improve research facilities, to unlock the huge number of young people who are excited and who are engaged in doing basic research and applied research. So I think it's a really exciting field to be in. One of the other things that I would say is that we take risks. I think the session, the previous day was talking about crazy ideas, and we can make things happen in Bangladesh. So, for example, one of the clinical trials that I've been doing is one of our top local pharmaceuticals took the risk, gave us an oncogene therapeutic biosimilar monoclonal antibody to do phase 1, phase 2 clinical trial, which we've nearly completed, I think, very successfully. But just to add on to what was said in the previous session, I think that we did have hiccups, we did have a lot of challenges, but the most exciting thing was that during the revolution, the uprising, when we had a lot of data collection, we had an amazing team of clinicians and our Escogen team. We had amazing volunteers who were knowledgeable, who were tech savvy, who everybody came on board to complete the trial successfully. So I think there's a lot of great potential.
Thank you very much. I believe that you have touched upon a couple of very interesting things. And it's not only about the clinical research, contractual research, or clinical research organizations, but also the replicability of it that if you could set it up together, and there's something that we have been working on for the last couple of years, particularly spearheaded by Oxford. We have some of our older colleagues sitting somewhere down there. It's about activating the complementary asset portfolios, that you have assets deployed all over the country, government assets, private sector assets, public assets, foreign assets. What if we could access these assets and connect the dots and see if we could leverage those data points and come to a conclusion, come to a situation which is congenial to our liking, our longing, our sense of belonging, that what we'd like to be. Here, I must, Foreign Ministry has a nasty habit of meddling into affairs of the identity. Bangladesh is a relatively new republic. For the last 54 years we are there. But we are sitting on top of more than 1,000 years of history. We have lost much of it. But with AI and other things which are coming up, I believe that this is time that we can try to access the things that we have lost. If anyone has read Alexander Fleming's 11 volumes of Indian medicinal herbs and plants, you'll see that much of it was actually collected from Bengal. And we lost it to Tibet, Sikkim, Bhutan, and in general the north. But those are there. So let's see if we could collect this information and reinterpret. What about that? Now, coming back to the panel today, we have Yuji-san, who is basically heading the Toyota Susho arm in Bangladesh. He has a vast experience across 4 different geospatial regions and investments and frameworks. My question would be to him, it's related to MIUP, M-I-U-P, he'll speak about it, that which provides preventive healthcare and checkup services in Bangladesh, almost first of its kind probably, it is as a generic, as a system, as a full system. The question is specific. What drew you to Bangladesh's healthcare sector? We know why we need healthcare. Why did you come? And how do you see your MIUP contributing to the country's broader bioeconomy goals, especially in the areas like diagnostics, digital health, and if I may add, bioinformatics?
Thank you very much. First of all, I would like to express my sincere appreciation to giving us such an honorable occasion here. And many of today's panelists and the audience, our company, once you heard, it sounds strange. Toyota is like an auto manufacturers, and we are a trading house. And then why we are handling about medical healthcare here, because of the history is talking to me. Once our is start with automotive section here, we always very respecting to the customer touching point. And also through the automotive, we try to taking care about customer care. Such a, how can I say, philosophy and culture in line with the growth of our business, we enlarge to the industry from automotive and to others, and finally we reach to the medical healthcare as well. Then nowadays, from the other investor point of view, Toyota Tsusho handling 130 countries, and also out of that one, in scope of the South Asia, today we handling 2 hospitals in India. The name is Sakura Hospital there. Then in case of the Bangladesh, thank you very much, Mr. Mamun-san said, MIUP. This company is providing to the clinic diagnostic service and then detection service with digital transformation and then AI analyzing in future. That meaning is we are focused on the social problem of the Bangladesh today because the density of the doctor is lower and the reach to the rural area or is less touching point there. Therefore, we start thinking about this milk company is certain contribution to reach to the patient who need to primary care first. That is a trigger of our investment into this country and this company. Then now we're talking about the biotech issues. Bio is not to stick to the medical care, but also like industrial or agriculture is there. Then the bio procedures is one of the very important matter is try and error. Tons of data is required, right? In that case, here is, today we investment in the MIUP is there very much strong sense about DX and AI. Such accumulated data, I hope, helping to the analysis for the similars or biologists. Those are implementing or supporting there. Therefore, we expecting to not only for the growth of the market, but also our own data also to be accumulated. And then this is a trigger to further investment for the future. That we thought about it. That is the answer to you.
Thank you very much. We'll probably be coming back to you if time permits. But next we have Fabrice. I believe that I got your name correct, from Sajida. See, before Sajida comes in, there is also a framework. I keep referring to frameworks like PESTEL, the full political, economy, social, technological, ethical, legal, technical, technological. But more than that, we have been working on a vantage point called the TMO framework, connecting technology to markets, underwritten by organizations with finance and feedback loops. So my question to Sajida and to Fabrice is, with your extensive global experience, how do you see your organization and particularly Bangladesh in the growth of biopharma, and what trends you are seeing, particularly in the bottom of pyramid markets, the emerging markets and also the BOP markets, and where do you see Bangladesh fitting in, particularly in South and Southeast Asian countries and globally? See, our ambition is, of course, we have written Bangladesh as the regional biohub, but not like to be constrained by the region alone. Why not global?
Right. Thank you very much again for inviting to this important summit. So it's a privilege to be here and part of this panel. So my name is Fabrice Gachot. Indeed, I'm representing Sajida, from the private sector, with core expertise being to deliver technologies, so advanced technologies and services to enable customers and players in the market to manufacture biologics. So that being said, the question is really about the trends, and what do we see around and in the region, especially supporting the growth of a bio industry. And let me focus on the biotechnologies especially. I was attending a WHO conference the rest of the week, actually, and I had opportunity to meet with representatives from Nepal, from India, from different countries around. And interesting to see the dynamic towards localization of manufacturing. And this is really an effect of the COVID crisis. COVID really acted as an accelerator, not that nothing started before, but obviously COVID really accelerated the initiatives to localize manufacturing of biologics. And I can mention 4 areas, let's say, that could play a vital role in developing the bioindustry in Bangladesh. One starts with the government initiatives. It has been said in the previous panel, but it is absolutely important to make the right reforms and have the right policies, let's say, to encourage this biotech sector to grow. So this is to really set the foundations to establish the bioindustry in Bangladesh. And we have seen positive examples, or examples like BRAC in India, for instance, that became instrumental to really ensure access of COVID treatments to the population back in 2020. A second aspect is international corporations. We have seen examples that, like in Indonesia with Novo Nordisk, signing a deal with Biopharma to manufacture insulin locally. And this is a great example of how the North can collaborate with the South, and there are others, of course, but in developing countries. So this is a new trend that we were seeing previously in China or India, but now that are impacting developing countries like Indonesia in this case. Third, I would mention is really the creation of clusters, of network of companies, and your company is an excellent example of that. It's really creating the dynamic to generate IPs locally. This is an absolute must, a starting point to create an industry, is to generate your own IPs, and so that you can build on it and then create locally. So having these biotech clusters, having incubators, create the scale, let's say, to let's say generate the right talents and the right momentum to create IPs locally. And last but not least, I would like to mention a very interesting initiative that was like a triangular north-south, led by WHO with support from the Medicine Patent Pool, consisting in transferring mRNA process from Africa to different developing countries. And actually Bangladesh is one of them with Incepta, which is an excellent news. There are others like Biopharma I mentioned in Indonesia, others in Ukraine, in Latin America, so in the different developing countries. And these initiatives are very positive in the sense that it will give you and Bangladesh a first, let's say, a first access to new technologies, to new modalities. One of the mega trends, and I think you mentioned it earlier, is really towards personalized medicines, or genomics, so new modalities beyond, let's say, biosimilars, beyond monoclonal antibodies, where we see now more and more mRNAs, of course, plasmids, viral vectors, a lot of new modalities that are, picking up. I could mention oligos and a lot more. I mean, of course, antibody conjugates as well. So this is an opportunity for a country like Bangladesh to catch up, to shortcut, and immediately go into these new modalities and take it from there. So I would say this can be accomplished through, let's say, these networking activities. I mentioned government, I mentioned clusters, but that's also networking on a regional level. Because one thing that remains very important is, if investors want to invest, is to make sure that there is a sound business case, right? And that means you have to have a demand, you have to have the right market size. Bangladesh is, of course, a very, very important population, but having ability to export within the region and outside of the region will strengthen the business cases. So networking with the different governments and Ministry of Health, across the region can enable to really strategize a little bit and make sure that there's no duplicate and no overcapacities built over time. So this is a way to build a strong bioeconomy, not only in Bangladesh, but at a regional scale as well. Yeah. Thank you.
Thank you very much. That has touched upon a couple of points which I believe that someone is taking note of. I have taken note of, and I believe that in next couple of days' time, we'll come up with a paper which consolidates the points which we have discussed. Adaptation, aggregation, arbitrage, the AAA model, that's also there. IPs are new identities. The identity politics of the future, the political economy of the future would be dependent on the identities and IPs that we'd be holding and not holding, and how far we'd be exceeding there. Now we have someone who from Bangladesh, who sits on the boards of some of the most cutting-edge tech giants of the world, if I may say so. From Caribou Biosciences to OpenAI, we have Mr. Sajid Rahman from MyAsia VC. He also sits on the board, the finance board. I think he's chairing the board of ICANN. And my question to him would be, in fact, we are consolidating two questions into one, that what makes investors tick for Bangladesh? And why would someone come here? Why would someone not come here? What needs to be done? What do you see?
Thank you. First of all, let me talk about the biotech investment in general, which I will connect to the Bangladesh scenario a bit more. If you look at you talked about the big canvas at the beginning, right? So one of the things that biotech, I mean, when we invest in a company, we are essentially have the front row seat of seeing a company grow and change the world. And in case of biotech, you essentially have the front row seat of a company which may actually change the trajectory of civilization, right? So because the next holy grail of innovation is not in the space out there, but it's within the human body. And biotech enables you to make that change. And as an investor, if you invest in such a company, the return can be huge. One of the companies we look at is essentially trying to manufacture human organs. I mean, if they succeed, think of the impact it will have. I mean, you can have a kidney or a liver manufactured in a lab. So these are the big impact that the investors can have. And of course, the upside of such an innovation can be significant. Now, if we want to go back and look at this big canvas and want to understand what are the challenges in Bangladesh, and actually, Sadaf was asking me, and I said, okay, let me think about it. But the first thing I see, which we touched upon a bit, is most of these biotech investments is very high risk, right? We call it moonshots. You invest in companies, in innovative companies, knowing it will fail. But when you invest in these sort of moonshot companies, you know the probability of failure is much more higher. So unless there is a very strong infrastructure support built in the country between public and private sector, and that's where the governments need to come in to really flourish and encourage outside investors to also invest in Bangladesh, especially in biotech. So that's one. The second is, if you look at the Bangladesh in general, there are very few R&D labs, and those would be mostly within Dhaka. You won't see this outside Dhaka much. So there is a very clear gap of a countrywide support to generate and encourage biotech companies. So that's where I think the government needs to play a much bigger role. The third, of course, is the regulatory landscape. I mean, I don't know how robust the regulatory framework is to support biotech companies in this country. I have seen companies which actually moved out of US because they found the regulation was too strict. So they moved in other countries where they could do much more experiments, ethically, but much more experiments. So how the regulatory framework turns out is also something that we, as an investor, always look at, right? The fourth is brain drain. I mean, we have some very clear, talents in this panel, but there is always this challenge of, we don't have enough brain coming back and actually involved in research in this organization. So there's clearly a lack of proper talents to support significant investments in biotech. So these would be the major challenges.
Thank you very much. On that note, I think I should do a little bit of a marketing for, no one likes government agencies or ministries, but I believe that you might like the Minister of Foreign Affairs to some extent. He spoke about business environment, he spoke about regulatory environment, and I think the Honorable Chief Advisor spoke about the way of making crazy things take shape, make it happen. And the Honorable BIDA Chairman spoke about converting super critics into super ambassadors. Why not you join or start with the Minister of Foreign Affairs itself? We have a strategic business framework, but for lack of time, would not be going into the details of it today, but each of you is more than welcome to visit the ministry, have a look at it, and see what we have done over there. Maybe we can connect with BIDA and the Chief Advisor's Office and see how we can leverage whatever that we have at hand, and if we could go beyond that. And on that note, we'll be coming back again to Professor Abed Chaudhary. Our question is the designated question first, and we have a separate additional question to you as well, because he has been a teacher, sort of teacher to me and to many in this room. So we have many questions, unanswered mostly, by the way. So Dr. Chaudhary, you have been involved in some of the most fascinating innovations that we have seen in the biotech sector in Bangladesh, particularly in genetics, from helping rice plants produce better seeds on their own and to reducing harmful gas emissions from cows, and even using gut health to improve personal well-being. Could you explain how these kinds of scientific solutions can turn into real business opportunities? How can we give them enterprise architectures, and how can we scale them up, connect them to global supply chain solutions? And in addition to that, why is that not happening?
Thank you very much. I want to be very clear about three things I'm going to talk about, so for the sake of simplicity, so these are the take-home message. Number one is 5 harvest rice, or panchabrihi. So in a village in Bangladesh, after 20 years of R&D, we developed a rice plant which upon cutting gives 1 harvest, then grows back again and gives the second harvest. And when you harvest that, it grows again and again till it gives us five harvests in 1 year. And this happened in a village in Bangladesh through the R&D via the farmers. And now we have progressed and we know the genes that are responsible. So panchabrihi, or 5 harvest rice, have now been extended to other crops in multiple harvests. And we are ready for investment, so please connect with me if we want to invest in this. We want to put Bangladesh in the map of agricultural biotechnology, because as you can imagine, this is one of the biggest story of contemporary times, where we found a very simple genetic control of multiplicity of harvest since the beginning of agriculture. Because the ancient farmers had selected for 1 harvest, because they didn't want this crop to grow again, and there is a sociological, anthropological reason for it. So my first message to you is that please invest in this Bangladeshi innovation, which is panchabrihi, which literally means in Sanskrit 5 times rice. Number one. Number two, I am binational. I'm Australian and Bangladeshi. So I was hired by the farmers of New South Wales to do something about methane mitigation. So we sequenced 500 genomes of organisms that live in soil, and then we deployed the deep mind of Google, which is called AlphaFold, where the machine translates everything into protein and gets the protein structure in about 10 minutes in some of the supercomputer back in Seattle in those days. But then Meta came up with a new ESM, they call it, to beat Google. So we deployed the Meta apparatus, and out of it came the solution for methane mitigation from cow. So Bangladesh has a very strong footprint of methane mitigation from cattle. During the Qurbani Eid, when all the cattle are congregated in certain areas, we can see the methane emitting from the satellite, from Tropomi 5. So we need to, increasingly, we are asked to mitigate this, and I had a very nice chat with the livestock advisor, Farida Akhtar, and she's very supportive. So please invest on this one. This is going to be Australia, Bangladesh enterprise, and even some of the earlier money was given by Sergey Brin and his wife, the owner of Google, and also Mark Benioff of Salesforce. They have kind of triggered this work. But this work is now available. If some Bangladeshi group of consortium would come, I have been told and designated the fundraiser, so please connect with me if you want to invest in this key technology, which will have the name of Bangladesh in it as well. Number three, my name has been suggested as part of Genofacts. So to make a long story short, I'm co-founder and chief scientist of Genofacts, and our goal is to sequence everything and do predictive medicine. So we want to genome sequence the baby that is just born today and predict its chance of getting different diseases, non-metabolic, metabolic diseases, as well as mental health profiling, and then create a trajectory from infanthood so that they don't have to encounter these diseases. So this is whole predictive DNA-based, you can call it digital medicine in the highest sense of being digital. And that is also up for business. We are raising money. My co-founder is here, Jahangir Alam from Australia. And we are active in Bangladesh. We are active in the West Coast in the US and also in Australia. So please connect with me for any of these three. Then your last question is, why isn't it happening? I would say it is happening. It is happening. It started yesterday. There was a most exciting day where we heard of people like Ashik Chaudhry and Lutfi Siddiqui. And I must say, ever since I left Bangladesh at the age of 22 and come back repeatedly, but I have never encountered people of this ilk, if I may say so. So there's a whole new breed. There's a whole new breed of people. I think it's a cliche to say a Nobel laureate is I don't want to overuse this term, Nobel laureate, in every word. But what is significant is there's a team there. So coming from Farida Akhtar, who is an activist, to Jahangir, Dr. General Jahangir, who is the agriculture advisor, very good discussion I had with him. I think the whole team is ready for business. Things are happening. And I would say, Jay, please give this government a chance. Thank you.
Thank you very much. In fact, I must add to this, is that we have, not only on this panel, but also in this room, market-ready enterprises, which can go into the market right now. And I know that this panel here, at least 4 of them have organizations which can scale up, which can go into enterprise-level formations, go for advanced equity, Series A, Series B, whichever way that you would like to call it, raise funds and go straight up into business. And I must say that the returns would be coming, in my calculations, in my humble calculations, within 18 to 36 months. Should not be more than that. And the returns would be humongous. See, back in 2001 and 2, when I had been in the bank, and I started my career in a bank before joining the foreign service, some of the organizations had IRR of 57% pre-tax. And those were like, shady organizations. But at this moment, what we are dealing with, again, in my investment banking hat calculation, I see that some of these organizations could go 500 times, 600 times if the IP succeeds and if the market is receptive enough. And all these could be done with existing technologies, just reconfiguring this. And maybe the government can play its part, right up, straight up, ahead with whatever that we have. Our laid out capital is huge. Look around, the schools, colleges, hospitals, in terms of its physical infrastructure weight, the value of it. We should not be going to any international body. We can collateralize one of our hospitals and just maybe draw 100 million. This can be done. Some of the organizations, even in the advanced world, can do it. Why not we? The Minister of Foreign Affairs land mass should be somewhere around 5,000 crore in Bangladesh, Dhaka. Well, we're not selling that ministry at this moment, but if we may, if we are threatened with money, we might consider selling that. What if we consider selling each of us here to the market inside the country and outside the country? We'll ask Sadaf next question. What do you see the government doing? The DCL projects, the animal house, and also this part, the finance part, because this is something which I see personally lacking. We have been asking the Minister of Finance, maybe the Financial Institutions Division is also there, the BSEC, that how we could take these early stage capital intensive organizations to the market and allow the people to hedge themselves and allow the organizations also to hedge themselves, both the organizations and the people combinedly going into the future together. How do you see to it?
Oh, thank you. It's a very, I think, very interactive, exciting discussion here, and I'm kind of just speaking to several points that have been raised. I talked, I think, previously about the role that contract research organizations can play at a level which is ready here and now. But I think there's a huge potential going forward. In the last few years in the West, big pharma, big biotech have actually outsourced 70 to 80% of their research needs. Sometimes they actually have specific tasks which they give to outside organizations for long-term servicing for them. So this market is actually $90 billion. And when I'm sitting in Bangladesh, I do see that we can go beyond. So just to mention something that Dr. Abed had brought up about personalized medicine and sequencing of genomes, when we're looking at the kind of data we're getting from clinical trials, having clinical trials here is not just about making money, it's also about bringing the latest cutting-edge therapeutics to our local patients earlier and cheaper. And like built on that is the kind of health data we can build up in terms of clinical, not only clinical data, but also at the genomic level as well. And that can inform not only our health policy, but also the care, and I would say not only for Bangladesh, but also regionally and globally. So I think that's one thing. So how do we build up this kind of system? We need the government support. And I was pleasantly surprised when dealing with the DGDA, the Director of Drug Administration, that it was ramping up. It was very supportive to CROs and other companies coming in this space. Of course, it has a long way to go, but all the indications are good. And I think that with a greater capacity where there's oversight on clinical trial monitoring and ethics oversight, as well as making the process much more smoother and much more efficient, I think we could be extremely competitive as far as kind of regulatory procedures and processes to actually get down and start doing things. But what the government is doing, I think, is when we're looking at what CROs do, much more than traditionally what we've seen CROs doing, I think in the future we're looking at basic discovery, drug development, and also inputs into high-end manufacturing. To this end, under the Fisheries and Livestock Ministry, I believe that there's a sort of state-of-the-art animal house which is going to be rolled out, which will actually give us an incredible edge in global drug development input. At the same time, there's been another venture which is ADB funded, I believe, which is the Vaccine Therapeutics and Diagnostics Development and Manufacturing Project, which is under the CDLC, which is the government-owned pharmaceutical. So based on that, we will have a lot of leverage to have high-end manufacturing with regulatory transparency, but also scope for R&D partnerships, global partnerships which can leverage disruption of current supply chains possibly, as well as innovative partnerships with vaccine and drug development companies. So I think there's a lot of scope there, but I just want to mention something else. It's a whole ecosystem. We were talking about the reverse brain drain and anticipating that, but also the importance of investing in fundamental and also applied science in Bangladesh. So I know a lot of the private universities, public universities are really trying to do that kind of research. The Honorable Education Advisor is here. I've talked to him about it as well. How can we leverage our young people and really give them the education that they deserve? So we do need streamlining of the UGC so that we can do innovative curriculums for our young people. We're looking to do, we're proposing a very high-end research facility in maths, physics, to give good foundational language skills to our people for bioinformatics, as well as a very high-end biomedical research advanced center. And I would say that we have had investment, but it's been a lot of infrastructural investment. We need soft investment to actually give research grants so that young people can, experiment away. And as you said, it's like a one in a, it's sometimes, it won't happen overnight. Maybe 1 out of 10 or 1 out of 20, but we will have our, I think, successes in the future.
Thank you very much. A lot of data points there. I have taken so much of notes that I believe that I would be taking a full-fledged keynote speech myself to summarize. So I'll not do that. But on that note, we'll give some of our panelists 1 minute each. The youth, look at this room. 90% of it is very young. The rest are young. The rest are young. The 90% is very young, almost like children. What do you have to them? See, I have seen the first lady who did her PhD on human genetics in the late 50s. We lost her to neglect and heartbreak. We have the first biotechnology, the female biotechnology student, Dr. Salma, sitting somewhere to my right, 1 o'clock, probably. who was one of the first 17 students from Khulna University, sitting right here. Now she is a professor. We have lost many. Well, we have kept gaining because we have the advantage of people. We have the advantage of young people. 140 million of them, someone said yesterday. That's the strength. That's a strength which is very difficult to overcome. What message do you have to them? Sativa and Fabrice.
Well, let me keep it very short. I think there is space for Bangladesh to succeed in the bioindustry in the world and locally, but in the world as well. And when I see, and as you said, I mean, the energy in this room, the foundations that we've discussed, the willingness, I think there is a path, obviously. So I can be only positive about future success. And if I may summarize the key enablers, I mean, I mentioned earlier, the need for a framework, let's say, policies and regulatories to be really supportive of this development. That's one. The second is in the generation of IPs, either locally or through partnership, but this is an absolute must. Third is about the business case, making sure that you're working on the right products, on the right diseases, the right technologies to be successful in the long run. The fourth is my part. This is the easiest one for me. This is about getting access to the technologies to manufacture. But obviously, it's not as simple as just like getting access to the technologies. It's about training future operators. It's about educating, having access to talents. And there are different ways to achieve this. One is by, and I was discussing over lunch, sending people from Bangladesh to Western world or universities and get the right learnings, let's say, about how to manufacture properly. That's one. But another one is what we can help you with. We can give access to e-learning, digital platforms to learn how to operate, how to handle these technologies. We have advanced learning programs that Bangladesh can leverage, and that could help you accelerate, in this journey. And then, of course, we are providing end-to-end solutions. So we are helping to de-risk, to make it smoother, simpler, and act as a one partner to give you access to these manufacturing capabilities. And this across the different modalities, as I mentioned, personalized medicine, so high-value products, but also biosimilars on the other side. So,
Yujison to the youth.
Thank you very much. This is a kind of a bit different opinion, but yesterday I very much impressed Mr. Yunu's comments. Crazy things, something make it happen. This is a message to the please keep our product liberty for young generations. Meaning is, okay, in Bangladesh may have a big potential to grow, right? And also very room to development as well. But how do we make it like a milestone for the future? That we need to have a more clear and easy to understand the vision there. Then that is a message, I suppose. Therefore, today's young generation is, some of them is go to the overseas to study because more high level or more specific measure they can take. But after graduating from there, still Bangladesh is more attractive, or is any other opportunity there to survive or something? But before they are coming back to here, maybe we also thinking about how do we brightness of the future of Bangladesh, meaning is not only for overseas, but also your or ourselves, Bangladesh people also be like it to Bangladesh, be proud. That is a very important for the next 10 years. Then also, second one is, thank you very much. I came from Japan. Japan is just 120 million. You have already 180 million. And once you're checking about the neighbors, like India, is 1 billion more, and China also there. Therefore, not so far, but already you are accessibility to big market there. Therefore, firstly, maybe we can make it better in Bangladesh market first. Then accumulated the data or accumulated people or educated, skilled people here is that eventually this stretch of the ability or capability is fascinated to neighbor countries eventually. That is maybe Bangladesh to a big potential to do it. I believe your company do it for that one. Thank you.
I have been told that people are getting impatient about meeting people on the stage and everywhere else, and there would be an intense networking session ahead. So before we go into that, I would request Sajid to give his shout out to the youth. What do you say?
Thanks. As you've seen, we have finance is a bit of a distance. So, keeping that finance cap aside, we are in a perfect storm, right? This is probably one of the best time to build biotech companies. The breakthrough in artificial intelligence is making a lot of the drug discoveries significantly cheaper. The regulatory landscape is quickly evolving. We have a new set of leadership in the country. So I think if you are a young person who is trying to build a biotech company, it can't be a better time. So go and do it.
These years, 2025, 26, 27, hypothesis is these three would be the make or break years for many things. These would be the years when things would happen or not happen. The choice is yours. There's an old saying from where I come from, niyat andaz barkat, which means your providence is depending on the niyat, on the intent that you have. The bigger the dream doesn't mean just daydreaming. Yes, daydreaming is part of it. Your conviction, that much should be your territory. So it's not only the sky. The end is not there. It's always beyond. With that, Honorable Advisor and the rest, we'll go into the next part of our program, which is the networking session. But we call an end to this session, this fantastic session. I hope that you'll connect us on LinkedIn and elsewhere.
Thank you so much. Now we've got, for a group photo, a couple of quite crucial instructions for all of you. We would have 2 sessions simultaneously at this point in time. One would be an investor-investee meeting. But unfortunately, or fortunately, it would be only for those people who have pre-scheduled the meetings, who have registered their interest with the Inspira team earlier, and Inspira team has confirmed the appointment. So a very small group of people, please get in touch with Inspira team. They would guide you to the investor-investee meeting room on the other side of the hotel. The rest of you, you'd be in this room because you'd be hearing from industry veterans. There would be 5 speakers. There would be 5 speakers. I know some of them, but I'm sure you know all of them because they are your industry veterans, your industry champions. We have Mr. Abdul Muqtadir, Chairman and Managing Director of Inspira Pharmaceutical Limited. So not now. So I'm kind of like making a little bit of arrangement to accommodate one of the speaker right now. So before you leave this room, you get to hear Mr. Abdul Muqtadir, who's the Chairman and Managing Director of Inspira Pharmaceutical Limited, to talk about the future of healthcare. After that, I'll come back again and probably continue with the further instruction. I'm holding off the networking and tea break session for 3-4 minutes. If you could kindly bear with me. Sorry, yeah. a little change in the plan. Can I have all of your attention? Can I have all of your attention, please? Yes. We're making a little change in the program schedule. So we'll just, before we go for a coffee break, give me 5 minutes before we go for a coffee break, because one of the speakers, and I'm sure whoever is in the healthcare and pharmaceutical industry, you know him very well. It's very difficult to get his time, so we have him, and we'd like to hear from him about the future of healthcare. So please be seated or keep standing, however you feel like. Do not leave the room. Do not leave the room as I pass the microphone. Sir, would you like to come to the stage, please? And while he speaks, I know we are all civilians, civil citizens. I'm sure all of you would cooperate and we'd be quiet and listen to him. Wonderful. A round of applause for our speaker, please. Can I have your cooperation? Could you kindly close the door? Because, yes, I'll be a little pushy. I'll be a little pushy and I'll be a little authoritarian. Could you kindly close the door? Give me 5 minutes. We're going to have the coffee break after 5 minutes, but I'm sure you don't want to miss the speaker. Sir.
Assalamu alaikum. Hello audience, can I have your attention please? You have heard a lot from the last session about biotechnology. You know that in pharmaceuticals, excuse me, can I have your attention, please? এই গ্রুপটা যদি একটু অ্যাটেনশন দেয় তাহলেই হবে এখানে I think they are the ones who are not paying attention. Let's see. Okay. Ladies and gentlemen, I know that this is almost at the end of the session, but I would like to say something about pharmaceuticals. You know that Bangladesh is very successful in pharmaceuticals, but that is basically in the frontier of finished dosage form. We manufacture all kinds of finished dosage forms, and now the emphasis is to go backward to produce API. Many industries have invested in API, but in API, the very basic need is primary energy. If you want to have API into multiple reaction stages, in every single reaction stage, you need energy. So the primary energy is extremely important for API industry. And the problem for us at this moment, that Bangladesh is currently able to supply something about 50 to 60% of its demand. So even if you wanted, it is going to be extremely difficult for the authority to supply required amount of energy. We hope, we are in discussion with the government, we hope that they would be able to start supplying primary energy. And this is my assessment, that not only in pharmaceutical, not only in API, not only in biologics, not only in vaccine, but there are many other sectors, like in case of garments, in case of textile, in case of small engineering goods, and in many areas, the primary shortage is the primary energy. At this moment, if we are able to supply primary energy to the Bangladesh, the way Bangladesh industry will start bursting up is if I give you an analogy, that in a gas stove, if you stoke a small piece of fire, then you get the whole thing done. So this is the situation where Bangladesh is. If we are able to supply them the primary energy, the whole country's total ecosystem and industrialization, development will just start moving so fast that we should be able to achieve maybe 10% plus GDP growth. So in pharmaceuticals, specifically, if we wanted, then we need the primary energy to kickstart the API industry. Leaving aside that, if I can add something on biologics and vaccines. In order for you to move forward in API industry, you need many, many different things. But fortunately, in case of biologics, majority of it comes from your mind. And you play with either a small bacteria or some other vector, some other host system, which you can design yourself, which works as your starting material. Then all you need is some nutrients and a control environment so that eventually you can get your end product. So there, actually the supply is control environment and some of the other processing accessories. So this is the beginning of an industry where we can catch on probably at the same pace that you see happening in other places. The gentleman from Sativa mentioned that Bangladesh is also working with mRNA technology. Yes, in SEPTA, our company is working with mRNA technology. Not only mRNA technology, there are several obstacles in mRNA technology, especially the lipid nanoparticle. But we are also working with certain other things where you can avoid nanotechnology and use of a long chain molecule. You can actually encircle your particle, which would give you same effect that of a lipid coated particle. So these are the new innovations are coming up, and we are working with Imperial College, and we would be able to give to the world, because this is the most expensive part of it, we would be able to give to the world access to mRNA technology by which it is going to be affordable. There are certain other things also I'd like to tell you, that in case of mRNA technology, you need capping reagents as well as you need enzymes. All these things are going to be produced in Bangladesh. So we would be able to provide at this level of technology all other components that is required to make mRNA actually economically feasible. So we are working on that. We are working on that. So we are not very far away from the cutting edge technology. The other thing is vaccine. Similar to biotechnology, also in vaccine, you really do not need many things except your brilliant mind. We have started working on this and virtually made almost most of the vaccines that you usually use in immunization. And if we try, maybe within 3 to 5 years' time, we would be able to make all the vaccines that are currently being used. So this is the situation where we are. If you talk about small organic synthetic compounds, many people would argue with you that probably we are far behind. And as I said, that you need the infrastructure ecosystem to be competitive with that. But the best thing that you need is human mind. And unfortunately, in Bangladesh, there are many chemistry departments where organic synthetic chemistry at the education level is not what we actually need at this moment. So we need at least 3 to 4 chemistry departments, which is equivalent to the best anywhere in the world, All we need, probably, let's say, 10, 12, 15 professors coming from other places, just put them into it so that we get, chemistry is the mother of everything. I tell you, chemistry is the mother of everything. So we need very, very high quality organic synthetic chemists in Bangladesh. And if we start doing that from today, I hope the education, from Education Ministry, somebody is here, and we would like to collaborate with them, and we can, so that make it happen in Bangladesh. Industry can come forward, and then we can actually build up a chemistry department which is at par with the very best. And you would be very surprised to see that even if you have seen 5 years back the status of chemistry departments, we see so rapidly changing it towards the east. Beijing University and National University of Singapore, their chemistry department is absolutely brilliant, absolutely brilliant. So I think the help is very nearby. If we can get some help from there, we can build up fantastic education institutions. This is what we need. So then the other thing, the venture capitalist guru, he was telling the ecosystem and regulatory system. And there is another one gentleman from USA, he's expert in clinical testing, clinical research. We need actually many clinical research organizations. More than that, these are physical setup, but we need clinical scientists who are going to be able to design clinical trials which are acceptable by all high-end primary, high-end regulators. Like, let's say, UKMHRA, FDA, they should be able to accept this. And we can get help from WHO. And thank God our drug administration is now gearing up to have their ML3 approval, and all 9 regulatory functions are in place. They are being trained up. So very soon we hope that we'll be able to get a drug administration which is approved by WHO, and we will have the required regulatory system whereby our companies, when they come up with newer things, they will get approval. So we need to sit with the government. We do not want everything, this, no. All we need is simple policy support and the regulatory framework so that we have an ecosystem which supports innovation. And if that happens, then Bangladesh is so strong in biological science. The biochemistry department is from Dhaka University is just absolutely brilliant. The biotechnology, or this is called genomics, or some in Khulna University, they are just absolutely brilliant, Khulna University. And Bangladesh is so rich in biochemistry and biological sciences. So we can take help of that. And this is the starting point. If there were about, let's say, 100 approvals in a single year, you would see almost like 70 to 80 drugs from the biologics. This is the time that we all have our acts together, sit with the government, set up the regulatory environment, set up the regulators, drug administration, have CROs, start research, and all the monoclonal antibodies which have so far, the patent had expired, hundreds of them. We should aim to produce all of them within just 1 to 2 years' time. And this is what is possible. It is just in our hand like this. It is within our reach. All we need is to have the right ecosystem. So, and we know what are the ecosystems that you have to build up. Please talk to us, because the industry knows every single obstacle that it is facing now. And we'd be able to guide you, give you things so that you can actually put those things in place. And once it is there, you never will have to look back. I don't want to take much of your time, but I want to tell you certain other things. If you look into the whole world, you will see only very few countries have the ability to produce pharmaceutical products. Leaving aside The Western world, which means North America, Australia, and Western Europe, China, India, and Bangladesh. These are the only few countries has the capability to produce all dosage forms. So Bangladesh is no loner. Bangladesh is not far behind. Bangladesh is far, far, far ahead compared to the whole world. The whole world. So we have so much of strength, so much of strength. We must take advantage of this. And if this is coupled, if this ability is coupled with biotechnology as well as with vaccinology, which makes it complete, then Bangladesh can actually lead the whole world in supplying high-quality medicines, vaccines, biologicals, everything. But there are many obstacles, and the laws and regulations and principles, policies, attitude, everything has to be ironed out. Please call us. Make it an emergency call. Bring them all together. Look into what are the obstacles. Very little, small, small things. Very small things. And just smoothen the pathway for us. We give you an industry which is going to be so good, and it is not the industry that people are ashamed of. This is an industry which is far, far, far superior and sophisticated, and people actually look for this. We'd be able to give it to you, and we can make Bangladesh so proud with producing high-quality medicines, vaccines, biologics for the whole world, and Bangladesh can benefit with the export of billions of dollars of export. So at the end, I would like to urge that please give us that opportunity so that we can cite the examples. These are the things that you need to solve. Give us a little bit of policy support. Change a little bit of regulations here and there, and then we give you this industry. Thank you so much for listening.
Thank you so much. Thank you so much, sir. I know I promised you a coffee break, but then again, with your permission, I don't want to lose the momentum, and I'm sure you don't want to lose it either. So we'd like to take another 15, 20 minutes. We've got 4 more speakers, industry veterans, your colleagues, some of the people you look up to, probably all of the people you look up to. We've got 4 more speakers. We'd like to hear from them, and then maybe at the very end, we can go for the coffee break. We'd hear from Mr. Mohammad Abdul Razak from the JMI Group. We'd also hear from Mr. John Rumi, Honorary Consul, Morocco and Bangladesh. Dr. Shoaib Ahmed, we're talking about industry-academia collaboration. So Dr. Shoaib Ahmed is a professor. And then we'd also have Mr. Andrew Smith, the board director of AKS Khan Pharmaceutical Limited. But just a quick announcement, we lost a mobile phone. If anybody can find it, he's the person that you need to reach out to. There's a missing cell phone. If you find it, if you see it around, please get in touch with this gentleman on my left wearing red shirt. Now, I would like to call upon Mr. Mohammad Abdul Razak, the founder and managing director of JMI Group, to, yes, sir. Within 3 minutes, if all of our remaining speakers, if you could have 3 to maximum 4 minutes, I think we'd be able to retain the attention of the audience. Sorry, you could take this, or you could also.
Honorable guest, distinguished delegation, and esteemed media representative, ladies and gentlemen, Assalamu alaikum, and good afternoon. It is great honor to privilege something today. My major is the medical device and medical equipment about in Bangladesh, where we are. Actually, we far behind about medical device and medical equipment industry here in Bangladesh. Mostly imported from outside to our country. I think it is almost 80 to 90%. Locally, we only produce 10 to 15% and very simple one. It is huge gap in our country. So my request today, here is the investment summit. Those are, want to invest in Bangladesh, medical device and medical equipment field is completely vacant. Why you investment in Bangladesh? We have lot of young, energetic biomedical engineer. Those are working different field because medical device and equipment industry is not available is here. I given the one example. Suppose earlier also, our earlier speaker told 2 crore, I mean 20 million people diabetes affected in Bangladesh. Simple only one device, every day they checking their blood sugar level. If 20% among these 20 million, 20% a day checking is the blood sugar, then this simple device, yearly cost is nearby 300 million US dollars. Only simple one device. So look the thing, more than 4,000 different medical device and equipment exist in the market. Among them we did nothing. I gave another good example, COVID. Nobody knows what it is. COVID is coming, everybody. Doctor call me, these people call me, Mr. Raza, what it is? Nobody know. We do not understand what it is. Finally, our company, JMI Group, because I am lucky, I was in Japan and I work with Japanese people. And then we started in auto-disable syringe, completely different mechanism. It is one kind of syringes, but completely different. So COVID coming, it is this auto-disable syringe, whole of the world shortage. We are only company in the Bangladesh. COVID vaccine time, we supply 300 million auto-COVID syringe supply to our government. And government restricted to me, I do not export because first we cover our country. And this is the true history. In Japan, because I am the, I think privileged, it is really, I am lucky. I was the, local partner, world renowned, and I think they are the number 4 medical device and equipment manufacturer in the world. Okay. So I can lot of learn from them. That's why in Bangladesh now they are investment in Bangladesh one product, that is the kidney dialysis kit. This company, only the company in Bangladesh, we export 40 countries in the world and we cover our local market also 100%. So my intention to ask the people, those are want to investment. Why you invest in Bangladesh? Because we have the average 26-year-old energetic people is here. Our market is here, 170 million people is here. So I think if you are decided to invest in Bangladesh, this is the right place. Thank you so much once again.
Thank you so much, sir. 3 more speakers, but I would like to kindly request all of them to kind of have a very brief speech. I think within 3 minutes would be really ideal. Can I have Mr. John Rumi, Honorary Consul, Morocco and Bangladesh to Honolulu, Hawaii, for his Billions for Bangladesh plan?
Hello, I'm going to make it real short. I know it went up a long time, more than the allocated time for some of the folks in here, but Honorable Chief Advisor, Nobel Laureate, Dr. Professor Yunus has said yesterday that we are innovative. We are an innovative nation. We are a country of crazy ideas. So we have a crazy ideas. Ladies and gentlemen, distinguished guests, and esteemed stakeholders, it is an honor to stand before you today to announce $1 billion for Bangladesh fund for healthcare. So with that, may I request my colleague Anis Rahman to say less than 2 minutes.
Assalamu alaikum and good afternoon. I'm Anis Rahman from Austin, Texas. Late last year, a few of us NRBs from around the world came together and formed Billions for Bangladesh. Billions for Bangladesh is a bold and ambitious initiative to raise $1 billion from the global Bangladeshi diaspora, each contributing $1,000 to create the largest investment fund in the history of Bangladesh. The goal is to invest this fund selectively using the social business model to reinvest the profit back into the economy, with the goal to eradicate poverty, drive unemployment to zero, and to create a sustainable future with a net zero carbon emission aligned with the 3-0 principle. Second, we are creating the largest ever database of 1 million Probashis that will provide an opportunity for global collaboration, co-invent, and co-create solutions. It'll also allow the BFB to identify global NRB talents who can then be encouraged to come and spend some time to give back to Bangladesh, much like what I am doing now. Third, bring foundational research being performed by NRBs around the world, much like Dr. Abed said, back into Bangladesh to transform the future economic trajectory of the country by creating disruptive innovations. If we do this right, in 10 years, we will see a different Bangladesh that will maximize on the human capital we have, a Bangladesh we can leave behind in our legacy that our future generations can be proud of. Please download the BFB app from Play Store. Apple version is coming in a few weeks. Or go to the billionsforbangladesh.com and log in and join the global BFB community. Thank you.
So if you believe in Dr. Yunus, our Honorable Chief Advisor, I believe in him, so we started Billion for Bangladesh Fund. I'm in the, myself, Billions for Bangladesh. It is going to be possible. NRB, all the Bangladeshis abroad who is going to make it possible. It may take a little bit of a time, but it will happen. But with that being said, I come from the investment and consulting world. I assure you the fund is transparent, is trustworthy. All we're doing, we're asking $1,000 for each Bangladeshi who are abroad. We need 1 million Bangladeshis. There are 20 million Bangladeshis abroad. We need 5% of those people. That would make $1 billion. It is possible. I believe in crazy idea. I believe in Dr. Yunus. Thank you very much for listening. I know it's been very short, but that's all I was given. 2 minutes. I think I did 2 minutes or less.
Thank you so much. I think that's kind of that's how we are. We are. I think the way we planned it, it probably didn't turn out to be as structured as we had imagined it to be. But then we're a little crazy, like Dr. Yunus said. We are a little chaotic, but that's where all the magic happens. I think we're gonna have the concluding remark right now. But then I think by now you kind of understood the enthusiasm, the opportunity for a lot of collaboration in healthcare, pharmaceutical, biotech, and other areas. And the opportunities in Bangladesh, especially in the healthcare sector, is vast. And it is clear that the strategic investment, if you do now, will make a pivotal role in this massive, massive transformation. To conclude this session, may I invite Mr. Ahmed Shaheen, Additional Managing Director of Eastern Bank Limited, to deliver the closing remarks. And after that, I promise you, there will be no speech. So your promised coffee probably would still be hot by then. If not, do talk to the Intercontinental Hotel. But I take off now. Thank you so much. My name is Zunaid Rabbani. I learned a lot, but then I give the microphone to the Honorable Additional Managing Director of Eastern Bank Limited. Sir.
Thank you very much. Thank you. I am seeking your attention for 1 minute. Sir, 1 minute. Seeking your attention for 1 minute because I am here to conclude it. Okay. It has been going with a lot of enthusiasm. That's the energy level and the participation. In fact, as a banker by profession, many discussions in expert levels were not in our cake, but we understand that a lot of opportunities and a lot of things are coming here. In Bangladesh, in the healthcare industry, we know that our pharmaceutical industries are doing very well, catering the 98% requirement, domestic requirement, and also aiming export. But in the hospital, healthcare sector, a lot of things needs to be done because there is a $5 billion estimated outflow for healthcare services. And a lot of biotechnology, telemedicine, a lot of opportunities are there. And we are very happy and getting excited with the connection we have with the Bangladeshi diaspora working abroad. They are connecting under BIDA. So we think that a lot of things will be coming where we can do more. So as lender, as banks, as financial institutions, we are looking at this opportunity to partner with the bankable investments, bankable propositions. And I, with this, thank you very much, all of you. You have done pretty well with participation, and there has been a little bit debate also. There are some positions, some convictions of some differences, but I think that is part of the development. Thank you very much again, and we will see you sometimes next. We will continue, try to continue these engagements to develop our industry and making investments. Thank you so much.